Good evening, everyone. Sorry for my tardiness, but right now I'd like to call to order the King George County Board of Supervisors budget work session for this evening. Someone like to do the invocation? Mr. Collins? Sure, it'd be great. Thank you.
Dear Lord, bring praise upon this board. Do your work. Bring us patience. Continue your work in this county for all our citizens, staff. In your name we pray, amen.
Amen.
Allegiance to the flag of the United States and to the republic which stands one nation under God, indivisible, with liberty and justice for all.
Thank you. I'd like to open the floor up now for public comment. If there's anybody here for public comment, you can limit your comments to 3 minutes. Anyone here for public comment? Seeing none, Mr. Dines, anybody online? Thank you. Board, anybody get any emails or correspondence? Okay. We will close public comment and we will move on to outside agencies presentations. Karen Delaney, step right up.
So we'd like to introduce Karen Delaney, and she brought, I forgot your name already, I'm sorry. From the Lloyd F. Moss Free Clinic. This was one of the agencies that you selected to present tonight.
Yes, thank you all so much for inviting us to share some information about the Lloyd F. Moss Free Clinic and the work that we do to improve the health and wellness of folks in our community. I'm going to allow Tricia to do most of the talking this evening. She's going to go through a few slides for you, and then we'll be happy to answer any questions.
Okay. Do we have control to? Thank you. Okay. Thank you guys for hearing us tonight and having us here. The Moss Clinic was founded in 1993. It's operated by the Fredericksburg Regional Health Council, and we are a 501c3 nonprofit organization. We are very proud to be providing comprehensive health care free of charge to low-income, uninsured, and Medicaid recipients who reside in Planning District 16. We've all faced challenges with COVID over the past 2 years, and the clinic is certainly not immune to that. As you've heard with healthcare workers, we had a scarcity of essential PPE from the very start, and loss of personnel and volunteers. While many businesses and services closed and citizens were encouraged to shelter in place, the clinic remained open 5 days a week, one evening a week. To care for the citizens in our community. We rose to overcome multiple challenges along the way with determination, innovation, and focus. We relied heavily on the volunteers. That's our model and how we're able to provide the resources that we do. And volunteers were our volunteer providers. They either, many of them chose to stay home for their own safety, or they were pulled into the ranks of the hospital or their respective healthcare facilities. So we lost quite a bit of help during that time. And at the same time, we're seeing an increase in demand. With rising unemployment, reduction in hours for many of our workers, they lost their employer-provided health care. So we were seeing a patient demand rise, a decrease in volunteer resources, and a decrease in revenue, quite honestly. We had reduction in donations because we lost that ability to have face-to-face meetings with our major donors. And in many cases, we had to either cancel or postpone or go to a hybrid fundraising event. So we've had a rough couple of years, but again, determination, innovation, and focus been getting us through. We have responded to the challenges with safety protocols and standardizations throughout the clinic to keep our workers, our volunteers, and our patients safe throughout. We've modified service delivery because regardless of what's going on, the patients still have the same needs, if not more, for healthcare. Addressing health disparities. The pandemic really brought to the forefront for the community what we've been seeing for years, and that is the lack of access to health care for low-income, underserved populations. For a variety of reasons, whether that be transportation, lack of internet access, lack of knowledge about healthcare, the healthcare system in general. Healthcare is not easy to navigate, and if you have a lot of other barriers thrown your way, and especially language and translation being a barrier for healthcare as well. We've opened vaccine clinics here in our facility, and in an outreach effort, we've given 111 vaccines for COVID-19 in addition to our flu clinics. And then we've offered COVID education to our patients, especially those who are very vaccine hesitant, just trying to help them stay safe, all amidst the standard of care that we've been delivering for years, our current and rising needs. And what we offer our patients, the devastating impact of a healthcare diagnosis. Imagine if you've been diagnosed with diabetes, heart condition, hypertension, and sometimes multiple issues, and then multiply that with the lack of funds to provide for that care and the lack of insurance. It can be devastating, and that causes additional stress to the patient as well. And even though Virginia expanded their Medicaid coverage, it's still not enough for many residents of our community to afford quality health care. We're proud to provide a broad range of services to our patients and our community in need. Through these, disease prevention, integrated continuity of care, and active follow-up, we're able to promote the health and well-being of our entire community. To be eligible for clinic services, one must be uninsured or a Medicaid recipient and having a household income of less than 300% of federal poverty guidelines. Now that's a change from previous years. It was 200, and our board of directors made the conscious decision to increase that because of the rising cost of healthcare being so difficult for many to manage. So what does that look like? A 300% would be for a family of four, may have a combined household income of $79,500. For a single adult, $38,640. So increasing that, we feel like we were able to make a broader sweep of our community. So where our patients reside, whether this is good for King George County or maybe it addresses that lack of transportation, King George is 6% currently of our patient population base. You can see Spotsylvania is the largest user of the services at Moss Free Clinic, followed by Stafford and the city of Fredericksburg. Just to give you an idea of what that 6% is, in 2020, 6%, we had 71 unduplicated patients from King George County. Now, an unduplicated patient means that's just the person that we count. When we look into how many times those people visited the clinic, that was up to 585 patient visits. So 71 people used the clinic 585 times in 2020. In prescription medications, those 71 people used roughly 960 30-day prescriptions, and this is just for King George residents. So just to give you an idea, average cost of a prescription, we calculate that out to be $51 per prescription. So that's over $49,000 just in medications to King George residents in 1 year. But that's a service that we're happy and fortunate to be able to provide because of the method by which the free clinic provides services. We see that our patients, 71 patients, 585 visits, they're disproportionately have over are affected by chronic disease. 75% of our patients overall have one or more chronic condition. And many people delay their treatment because they're worried about cost. So that becomes very acute, and they oftentimes wind up in the emergency room, and we know that's the most expensive way to receive care, and that impacts the cost for all of us. So in 2020, we had 1,171 patients, and you can see 9,779 visits. Prescriptions, there were over 16,000 prescriptions dispensed over the course of a year, over almost $1 million worth of medications. If you looked at the care provided, the diagnostics, and everything included, $8.85 million in services provided free of charge to the residents of our community. So that's a lot of numbers. I like numbers, I'm a numbers person, but I think what can really show the impact of your contribution to the Moss-Free Clinic and the contribution of our local governments and our donors in general, and thanks to those, here's a patient story that we just want to give you an idea of the personal side of what the clinic provides. This patient said she credited the Moss Clinic with saving her life. She came to the Moss Clinic, she'd been laid off and lost her employer-sponsored health care. She had hypertension and diabetes, was currently had been taking 5 medications with a monthly cost over $1,500 a month. She was afraid to go to the doctor because she knew she couldn't afford the meds. A friend suggested the Moss-Free Clinic. She was able to use our online eligibility screening process and get in quickly to see the triage nurse. They were able to transfer her meds to Moss Clinic, and she was able to schedule regular visits to monitor her conditions. She was also referred to our mental health provider so that she could get some support for the stress and anxiety she was experiencing. Through healthy living classes and education, she was able to get information and referrals to the food bank and to the YMCA for a healthy living class. Her A1C improved tremendously. She lost over 30 pounds, and her overall sense of well-being has really been restored. She's now working part-time and hopes to find something full-time with benefits. This is just one story. When we have a patient who leaves us because they have gotten a job and have insurance, then we've done our job. And we couldn't do that without the support from all of you. So thank you for hearing us tonight. We hope you'll consider our request, and we're happy to answer any questions you might have.
Thank you. Any questions for anybody? Collins? Okay, thank you. Thanks, Karen.
Next, we'll have David Cooper. He's the CEO for the Thurman Brisbane Center, and he will has a presentation for you as well.
Thank you. I'd like to direct your attention for just a moment to the screen. If you see there, homelessness, which is the primary purpose that the Brisbane Center is here, we're focused on helping folks to become fully engaged, stable, proactive citizens in the community. So some of the issues like drug addiction, mental illness, domestic violence, income inequality, family rejection, alcoholism, student debt. Also, I'll add to that folks returning from criminal incarceration. Those are areas that we address at the center and have been since 1988. I'll tell you that in 2005, in this 16,300 square foot building, since 2005, we've served over 7,000 individuals. In 2019, before COVID came along, we served 30 individuals from King George County. We helped them to get back on their feet. We helped provide stability in the shelter. We connected them with wraparound services so that they could become citizens again. One of the challenges, as all of us in this room know, is that affordable housing is one of the challenges that they face. So we are equipping folks around workforce development so that they can become as stably housed as possible. A piece that I'll add to this is, and I think Karen said this a moment ago, transportation out here to King George County is problematic because this county has some housing that some of these folks may be able to afford. So that is one of our challenges. I'm not going to go over every slide, but if you, let's see, do we hit this button to advance? Oh, sorry. Okay. So I want to draw your attention to King George County. You'll see that from this graph, there are 210 families that are behind on their rent, family households. Those are folks that are at risk of becoming homeless. That's the reason that the Brisbane Center is here. We're here to serve folks like that, that if they become homeless, they'll have a place to stay, to get back on their feet, to become engaged citizens in the community. Why does the Brisbane Center do what it does? Up until about 2 years ago, we saw close to 50% return rate to the shelter. Folks were at the shelter that had been there before. We don't want that to happen. We want to equip folks so they don't return. I'm happy to report that now our return rate is down to 23%. And we're continuing to move in that direction because we want folks to be stably employed, stably rehoused. By the way, the housing first approach that HUD uses focuses just on paying for people's housing with no requirement for sobriety, mental stability, or employment or seeking employment. We find that problematic. That's why the Brisbane Center is a place for transformation. It's a place where folks can get on their feet again. Numbers that you don't often hear, many of the public don't often hear. According to the HUD statistics, there are about 200 people across the entire planning district that are considered homeless, according to that definition. If you look at this, you'll see that in the Planning District 16, there are over 1,000 children that are considered homeless, according to the McKinney-Vento definition. Those are children and families that are housed in hotels. They're doubled up in places that are often they can't support long-term.
Funders and financiers of social services are often driven by a common goal to help people and strengthen communities.
You're not going to be able to hear that, so I'm going to stop there. You heard me say a moment ago that we reduced our recidivism rate. We're measuring outcomes. Is someone employed? Are they mentally stable? Do they have self-esteem? Do they have opportunities to create a better future for themselves? We don't measure just in bed days anymore. We measure in someone's self-esteem, their employment income, their capabilities to engage with the community so they can sustain themselves in housing. Our mission is to provide temporary shelter and equip residents for employability. We think employability by those that are capable is vitally important. What are our impacts? We want folks to attain at least 200% of federal poverty level so they can be sustainably rehoused. We focus on sustained rehousing for more than 2 years. And you already heard me talk about returns to shelter. We're actually better than 30% now. How do we get there? We want accountability among our clients, the folks that stay at the shelter. We're looking for folks that are committed, those folks that are capable, they're disciplined, that they operate with humility, they're open to coaching. For instance, in our mobility mentoring program, they're determined for their future. I learned something long ago in my work across the country that if you do for others, you rob them, deprive them of self-esteem. You weaken their development of life purpose, and you often promote dependency. We want to create independent folks that are interdependent even, so they can engage with their community. So we do work for folks for transformation. If you don't remember anything else from my presentation tonight, I'd like for you to remember that the Brisbane Center is not just a shelter, it's a place for transformation. We work with folks on workforce development, on self-esteem, on capabilities, so they can be sustainably successful in housing for their future. So those are the things I just mentioned. What are they capable of? Do they aspire to participate in shaping their future? Are they measurably working on a results-based plan? Are we applying the correct and appropriate care and concern to help them to be successful? And we want to be good stewards of the resources entrusted to us by our constituents. This county is certainly one of our constituents, so we're grateful for the support that you give to us, that you invest in us. You heard me mention about outcomes, so I didn't bring it along tonight, but I'll leave some copies with you of what we call the Brisbane Bridge to the Future. And so that Brisbane Bridge has 7 outcomes associated with it. The residents are working on with their case manager and mobility mentoring coaches on a plan to achieve realistic goals. Those goals are set and accomplished by clients. We want sobriety in the shelter. We want folks to improve their physical and mental health. And by the way, we do partner with a moss-free clinic. Healthy parenting. We want to end the generational cycle of poverty and of homelessness. We see it all too often. We want folks to apply their own skills, their own strengths and capabilities for their well-being. And we also want them to save and invest wisely. That's part of our mobility mentoring program. We work with folks to develop their budgets, to work on a plan for their future, financial plan. As you heard me say earlier, we want citizens engaged in the community. We want mutual care of home and community. So I'm not going to go back over our impacts again, but I want to leave a little bit of time in my presentation to answer any questions you have. First, I'd like to go back to my previous statement. We served 30 people from King George County in 2019. We anticipate serving about 27 from King George County. We've asked this year for a little over $34,000 in our request. You could do the math. So if you divide into that, the number of folks we serve, that's about $1,200 per person. That's a nominal investment. That came in our application to United Way for the county. And so this coming year, again, we would anticipate serving 27. We want those folks, your investment in those folks, to yield some good returns on the investment. We'd like citizens to return to this community. So with all of that, let me ask, are there questions?
Anyone with questions? Mr. Granger.
Yes, sir. Thank you. Thank you for coming out. Did you say your request, I had a different number. Did you say 34,000? Because I showed 32,473. I just want to make sure.
Let me get the number again. It's $32,473.
Okay. What was your request last year? Do you know?
Our request last year was 15,000.
15,000. Okay, so that's and I believe the county adopted 9,500. Was okay. So it's about a 100% increase in what you're requesting. Can you explain what's causing that?
Happy to. So 25% of our revenue for the agency comes from jurisdictions such as King George County. 25%. We have to fundraise the other 75%. And so fundraising in this economy, these challenges is challenging. So we're looking for counties to bear the expense that it costs the agency to be able to provide shelter, to provide hand-up services, wraparound services. So that's why we've increased, looking to get closer to what the actual cost is to be able to provide the supports we provide.
Okay, thank you.
Other questions?
Anyone else? Mrs. Kupka?
Thank you, Mr. Chairman. I didn't have a question so much as, again, thanks for coming out. I like the link that you shared. I wasn't familiar with that, and I don't mind telling you while you were talking, I went on the page and there's a lot of data there that I was not familiar with. So thanks for sharing that. I like data.
You're very welcome. And in the slides, you'll see that we're concerned that there could be a tidal wave coming. already we're getting a number of calls, folks that are being evicted, folks that no longer are able to stay in housing that have been provided for by pandemic funding.
Mr. Chair,
Yes, Ms. Bennett.
and just, it was pointed out to me earlier, I had a conversation with the shelter is now going to open up to 80, correct now, as it was restricted earlier?
We were, through our discussions with the Virginia Department of Health, CDC, and OSHA, we reduced the capacity of the shelter to 52 during COVID. And I'm happy to say that we've been able to maintain. We haven't had a major outbreak at the shelter, haven't lost anyone at the shelter. So we are, as of April 1st, our plans are to return to a full 80 from 52.
Thank you.
Sure. Thank you.
Anyone else with questions? Ms. Collins, nothing? All right, Mr. Cooper, thank you very much for coming out.
Thank you.
And next we have Ms. Kim Lett, who is the Deputy Director at the Disability Resource Center.
Okay, thank you.
Good evening, Ms. Lett.
Hi, how are you? Thank you
Welcome.
for having me tonight. Our director was going to be here, but she had some medical issues she had to take care of, so I'm here tonight, and we will see how this goes. I'm from the Disability Resource Center of the Rappahannock area. We have been in existence since 1993. We are what's called a Center for Independent Living, which is kind of a misnomer. We do not provide a living space, but what we promote is independent living. And that we'll discuss on the next slide, I believe. But we are one of 17, what we call CILs, Center for Independent Living in Virginia. And we serve, of course, King George area and the other PD 16 communities. This year is also the 50th anniversary of independent living. The first center was created out in Berkeley in 1972 by a man named Ed Roberts. Ed was paraplegic, but yet he lived life fully, as you can see. And that is our whole purpose, is to ensure that people with disabilities live the life of their choice and live as independently as they can be. We serve people of all ages, all disabilities. So you can see an older gentleman right there that we helped transition out of a nursing home. He lived here in King George. He recently passed. And our young lady in the middle, and a girl from our youth group on the end right there. Independent living is like living like everyone else. It's basically, I say, it's having your own voice and your own choice in your life, having opportunities to make your own decisions, not always having people talk for you. People with disabilities have the right to participate in all aspects of their life, and the guy in the red coat there happens to be my son. He's 34. He has autism, and that's his personal assistant, who is also a local leader in a rock band. So we kind of bring the community together. All different kinds of people help us with our work. All our services are free. And all staff and board must, 50% of us must be people with disabilities, so that we understand the people that are walking in our doors. Our core services are independent living skills training, and that can be any number of things. It depends on what an individual needs when they walk in our door. Sometimes they don't know what they need, and we have to sit down with them and help them fine-tune that, but it could be they're just getting Social Security. They need to learn how to budget their money. They've just moved out for the first time. They have no idea how to cook. They need to know how to act correctly socially on the job. We work with them on those kind of things. Advocacy, that is teaching people self-advocacy, but also legislative advocacy, which we've been busy with the General Assembly here the last couple months. And it's people calling us, about issues that they have with living, or they can't get modifications on the job or things like that we help them with. Information and referral is the biggest thing we do, is providing information to people on where there are housing resources, where there are medical resources, transportation, those kinds of things. Peer counseling is really should be peer mentoring. It's just person with a disability talking to another person with a disability. One of the biggest things we do is transition from school to work or transition from institution to home. Our person that works on nursing home transition was, I know, on the phone to all the nursing homes, including the one in King George, talking about services that we could provide their residents. And we work with students that are transitioning out of school. Historically, they're supposed to have services that help them make that transition from the school. A lot of times, most of the time, it doesn't happen. But they need information on housing, and parents need information on possible powers of attorneys and guardianships, and they need information on jobs and transportation and what they're going to do with their money. So we work with students on that. This is our equipment connection. We do over 2,000 pieces of equipment loan out. And I say loan, actually, it's a reuse program. People can keep the equipment forever, or if they don't need it forever, donate it back to us. But over 2,000 pieces of equipment go out there every year. And yeah, that's Eric, our trustee equipment connection staff member. And that's a huge service that we provide the communities in this area. We have walkers and hospital beds and wheelchairs and canes and scooters and you name it. This is a new program that new, a couple months old, that we've been working on. We are reaching out to individuals with disabilities who have not had a vaccination, finding out why, what are the barriers. A lot of times they're scared of the healthcare environment, or their health prevents them from going out in public. There's a lot of different reasons at any rate. So we're trying to identify those people, see if we can get them vaccinations, and we're having a vaccination clinic to that end. So we'll be doing outreach on that. These are just some of the programs we offer that support our core services. Our empowerment group, our sibling group, that's for brothers and sisters of those with disabilities. It's hard to be a brother and sister when your parents are devoting so much time to another child that has significant needs. There's our advocacy group, Ignite Change. This is our independent living groups. The Brew Crew is a big one. We've just started. It's individuals with disabilities meeting together just to socialize and relax. A lot of times, every time they're together, it's, we've got to, we're going to work on a skill, or we're going to do this, or it's Special Olympics. This time it's just to sit around and talk and have a drink. So they don't get that very often, and they don't get those opportunities to socialize. The Bean Group is just teaching independent living skills. Live Life Your Way is our YouTube. We did videos in independent living skills. We have an exercise class every Tuesday morning that Tenny teaches to people with all different disabilities, modifies it to somebody's needs. We're doing a new program called Bingo Size, which is a fall prevention class for seniors. It's an exercise class. Our chronic disease self-management, we don't have one scheduled now, but we will. We do that on a regular basis. We have a Giving Back Sound where people donate hearing aids they no longer use. We have a local audiologist that cleans them, remolds them, and forms them, and then we give them out free to people that cannot afford them. Our Deaf and Hard of Hearing group meets at the Disability Resource Center. The president lives in King George, right off of Kings Highway. She's also our service dog person, knows a lot about service dogs. And we've just installed a hearing loss kiosk so people can come in and get their hearing checked in our building. We do a veterans home modification program for veterans. We do rental modifications, and we keep a personal attendant service registry for people that want to be personal attendants. Currently, it is extremely, extremely difficult to hire personal attendants because the pay rate that the state has allowed is extremely low, and it's not just in Virginia, it's everywhere, unfortunately. You can go to McDonald's and get paid a lot more than you can being a personal attendant. Unfortunately, On the plus side, it's a very rewarding job. It gives you lots of good experience if you're going to be moving on to something else in your life. And my son has had some great ones along the way, I have to say. It's just our social media information for everyone. And that is what I have. One of the things I want to say is we do a lot of trainings. We do one on the Medicaid waivers that help support people with disabilities to live at home. We do one on Social Security so people understand their Social Security. All our services go towards helping people to not just sit at home. We've had some conferences before, and I think the title of one was How Comfortable is Your Couch? We don't want people sitting on their couch. We want them to either be out working, be active, contributing back to their community.
Thank you, Mrs. Lett. Any questions, anyone? No? Mr. Chapman? I looked to you, but I didn't ask for the other two. I'm sorry. I would have hoped you would have chimed in. Thank you. Thank you, ma'am.
So while Mr. Dunn is pulling the presentation back up, the next. The first thing that I want to, or the next thing in the presentation is we want to revisit the ARP slide that we had last week. And so I believe for the majority of this, except for the sheriff's office, I think that one was more self-explanatory. I provided each one of the members a write-up from the department heads concerning the different requests that they have. And Ms. Gump wasn't able to be here tonight, but I did send her information to you. So I've asked the treasurer and Ms. Summel from Human Resources to attend in case you had any questions for them. And so
And just to recap, so this is the ARP money that you get. This is the additional, it was done in 2 stages. You got it in July of 21, and then you would get it again in July of 22. And so that's, again, I think these are the projects that we were recommending. And I think is what Donna said is that there's a problem with any of these in the sense you don't want to have them in the ARP, then we have to put them back in the operating budget, or you have to tell us that you don't want them. So we just wanted to let you know that.
and all of these projects would qualify under the loss of revenue from the ARP.
Any of the board have any questions for the directors of these departments?
I'm just going to ask, could you remind the amount for the ARP?
2.6 million of that right now, 150,000 has already been dedicated to the broadband project, but the rest of it has not been.
Okay, thank you.
Mr. Chair, I did have a question.
Go right ahead.
Amanda, I had a question on the learning management system. Because I went to your website, thank you for providing it, and I found a lot of information, but I couldn't get more because you had to put in your email address and a lot of information to let them send you more. So I saw it was very human resources based. Is that what you were looking for, is training for like new employees and being able to manage human resources items?
Sorry. Okay, there we go. It has over 1,500 courses from compliance to IT, things like Excel and Word. So we would build programs and tracks from that learning management system.
Because I know we've talked a lot, especially on the service authority side of training, you know, to be, so it could be adapted. I told you I couldn't get too deep into it because they wanted a lot of your information so they
Yes,
could data
so they can
mine you.
call you.
Yeah, so it will include those?
So now things like wastewater certification,
Well, I'm just using that as an example.
it doesn't cover that.
Okay,
I will tell you, it doesn't cover that. So
but
it's not a everything training system, but it will hit a lot of the deficiencies that we have. So compliance training, like harassment, what we do every year, workplace violence. Like I said, IT has done safety and security training every year, so we would hit all those. We could also meet with the departments, which I did a couple years ago, to develop their own tracks. So if the treasurer, for example, had specific courses he wanted his people to take, we could develop those. But again, 1,500 courses is not just in HR. There's a public safety section. I don't have the list with me currently, but it would reduce the number of the monies that we have sending people away to training. That's one of the biggies. Wouldn't have to spend the overnight budget for hotel, for food, and things like that. We could do it all in-house. You could do it anywhere you have a computer, so you wouldn't necessarily have to attend the course. You could do it, you know, at your convenience, or when you have time in your daytime to do that. So it would hit a lot of those boxes.
okay, well, thank you, because the free without putting in the information, you couldn't get all that information. Thank you.
Yes, ma'am.
Supervisor Bender and the rest of the board, one of the things that we are going to do that would be affiliated with what Amanda is proposing is that all the departments are going to prepare annually some kind of a training and development plan. It doesn't necessarily mean that we're going to be able to fund everything that they want to do. Some departments, obviously the sheriff and fire and rescue, they do training all the time, and they, you know, that's a very intensive part of what they do. But we want every department to have what I call a training and development plan that's part of an overall operations plan. And so that will dovetail on what Amanda is proposing, because one of the things that happens a lot of times is that departments go, oh, this looks like a great training thing. Hey, I ought to do this. Well, is it related to your mission? Is it related to, strategically? Is it something that we want to be doing? And I think that's something that we think that this system allows us to track it better and to manage it better and to really, see that there's, growth that we're providing our employees. And I think that that's something that will go with this, and we'll have that ready for July 1. You'll get to see it. It'll be an informational type item that you get to see what all these departments are doing, what they want to do for the next year. And they'll update it every year.
I was just going to ask, it is updatable so that you get the newest information. Okay.
Yes, you can even develop your own coursework. So if we wanted to make it specific to King George County, wanted to create our own class, we could do that.
So any employee could come in and know what the steps are to go above and what kind of certification they need when you develop this whole thing.
Yes, yes. Ultimately, we'd like to develop a King George University. Again, it would be very intentional. We would have courses set up in tracks. So new hires, they would have certain courses they would have to take. Leadership development, so that's key. Supervisors, sometimes we promote people or we move them to a managerial position, but we don't give them the training to be a good manager. Peer to boss is another one. Again, some of the compliance training is included. So harassment training, for example, we did that this year live and in person. It was received very well. But this would allow us to do training every single year, and they give you a variety of courses. So for harassment, there's 7 different harassment courses. So say the first year you took a harassment course is 40 minutes, 45 minutes. The next year, as a refresher, you take a 30-minute class or a 15-minute class. So there's variety in how you can create your tracks, but you definitely would have to manage that. It wouldn't be a system where you could just go in and I want to select
Excel today and Word tomorrow. We would have somebody to manage that. It would be permission-based. So if you had courses that you wanted to take, that's a discussion with your supervisor. They would have to approve it. For compliance training, there's emails that would go out as reminders. Hey, you haven't completed this training. You have until this date. And that will continue to go out until it's completed. There's reporting that we can pull from that as well.
All right, thank you.
Yes, ma'am.
Mr. Chairman, may I ask a question? Thank you. So the cost on here, $23,900, is that a one-time cost or is that an annual subscription cost? What are the other future costs associated with this?
Okay. So that does include the cost of the initial system and the training and implementation, but then there's a recurring cost after that each year, annual cost.
Do you know what that is? An estimate?
I believe you subtract about $5,000 from that, so roughly $18,000 each year.
Thank you.
Yes, ma'am.
Anyone else? Amanda, I know they had a lot of some of the surrounding areas all joined together in training and stuff as well. I mean, is that something that the other, smaller counties or towns could come here to join in on training like that? Was that something that would be offered, or is that just for in-house KG people?
I would say that probably the preference would be is just for King George County, not to say that you couldn't have a training here in this room and invite others to come in, but it would be hard to track it, for other counties. I do know, for example, Spotsylvania, I think they have this system as well as several others under NeoGov. But it could be done to have the training, but again, just tracking it. Maybe we give a certification or a piece of paper that says you completed this class. That's a possibility. For sure, that we could do that.
Just asking.
Yeah.
Okay, thank you.
Okay.
Any other questions for any other department heads on this list? Move on to 5 or?
How would you like to handle this? I mean, if you're saying you're good with this, or you want to, is this something you're going to come back and look at later, or what? I think that was what we were hoping is you get clarity that you're good with adding this to the ARPA or the Arp funds that we'll have.
Guys good in adding it tonight, or do we need more time to look at it further? Mr. Chair. Collins.
I don't have any problem with the sheriff, register, or treasurer. It's not that I have a problem with the human resources. I'm just concerned about the recurring costs. So I think that might be warranted for more discussion, but the other ones I'm good with.
Thank you. I agree with Mr. Collins. I would like to discuss the learning management system a little bit more, but I am willing to move forward with the other 3 tonight.
I'm amenable with that as well.
I agree also.
Okay, so what we'll do is we'll pull the learning management system, bring it back, and you'll consider it as part of the rest of the operating budget. And then, and if we need to get you some more information, please let us know. But then we'll go ahead and plan that the other 3, treasurer, registrar, and the vehicles will be in the ARP. And so whatever that amount is, 450 something, 56, I guess, 55, 455 will be what will go in ARP, plus the 150 that you've already obligated for the broadband.
Mr. Chair, for our 2 citizen advising, can Mr. Miller just explain the ARP fund just very briefly to them so they understand? we're throwing around acronyms, so.
Right, and I'll give you the broad overview, and then Ms. Hahn, our finance director, can tell you about maybe how the calculations come together. But ARP is, when the pandemic hit, Congress and the federal government passed it's called the American Recovery and whatever it is, the rescue plan, and it was meant to reimburse governments, and it's based on the idea that they were losing revenue during the pandemic because they were either closed or services were directly impacted in some way. That there's a particular calculation that you have to go through, a formula that Ms. Hahn does, and then you work with the federal government, and then they tell you what you're going to get. And so last year we got $2.6 million to start this current budget that we're in. And the board assigned projects back in the fall of 21 that, we're utilizing those funds, the 2.6 million, and then the other 2.6 million that we'll get in the next fiscal year, which is what we're talking about right here, right now. And do you need to tell them a little bit more about
so the American Rescue Plan funds were provided by the federal government, and they determined how much each locality would get. And it was to come in, like Mr. Miller stated, in two separate buckets of money, one at July 1st, 2021, July 1st, 2022 for the second. In addition to, you could use the funds for public safety, dealing with the pandemic, but one of the broadest terms is the loss of revenue. And so there was a huge calculation that had to be done, and that was listed in the interim final ruling for the American Rescue Plan. And in January of 2022, they determined that they were going to throw that out. You could still do the calculations if you want, which I did back last summer. Or you could just say that your locality had $10 million worth of revenue loss. Doesn't mean you're going to get $10 million. It just means that you can use $10 million as your revenue loss. When I did the calculations previously, every bit of the money that we received was less than what the revenue loss for King George County was, based on a progressive scale over pre-pandemic several years building and how much your revenues increased over time. So we have used some for public safety as well as other projects, as Mr. Miller stated, but anything that we are doing can fall under that $10 million threshold of revenue loss, even though we only get 5.2 million total. Okay, the next part of our presentation is you wanted all of the department heads who were requesting additional staff to come before you tonight. And so what you have in front of you and in the presentation is a list of those positions. And since I went last during CIP process, I'm going to go first tonight. And if it's okay with you all for me to sit here, Lavita is handing out some supplemental information. And so what I am requesting in this year's budget is for a procurement manager. And procurement has been up and down in the county for numerous years. But starting in 2009, procurement at that point we had a procurement manager, and the procurement assistant was hired. That manager left the county in 2015, and the assistant became the manager. Another employee who was currently part-time in the finance department became full-time, and part of their duties were to assist the new procurement manager. In 2018, the procurement manager resigned, and another staff member was promoted to this position, which had to be learned because that individual was not one of the ones who had previously been working in procurement. The other finance staff member continued to assist with doing some of the smaller tasks in procurement, and as well as the CSA coordinator. And then in July of 2020, she got reassigned to the Department of Social Services. So we lost that additional help that procurement had. Then later in 2020, the procurement manager got promoted to the accounting manager in training. And so from October until January 11th of 2021, she was still trying to keep procurement afloat while learning her new role. As you all know, that Barbara Howard Johnson retired after 33 and a half years in King George County finance. In January 21, another finance staff member was moved to procurement as a procurement specialist. While the employee had finance experience, there was a learning curve. In April of 2021, along with my duties as the director of finance and in the middle of budget season, I took on the role of acting procurement manager. And it's a role that I have continued in and still today in that role. The county processes purchases and solicitations for the county, the service authority, the King George County Schools, as well as now the Department of Social Services has adopted our procurement policy. So we've worked with them on a few smaller procurements, not anything that had to go out for a solicitation yet. So the list that Lavita passed out to you all while I started talking was this. I wanted everyone to understand what goes on in procurement. So we have small purchases, anything that's under $5,000, departments can go out and make their purchases either with their credit card or get invoiced for that. Anything over $5,000 requires a purchase order. I also forgot to mention in July of 2021, I did some shifting after the changes that took place in the previous fiscal year of moving the one employee to social services and another employee was moved to fire and rescue. So finance lost a couple of positions, but the work stayed there and continues to increase. And so I did some reassignment of duties and moved another individual over to a procurement specialist, and our admin assistant took on schools payables. And so the admin assistant / school payable, she does some of the smaller purchases like for our RICO copiers, things that are routine to help out with the purchasing function. But the majority of that is split between the two procurement specialists now. And then, so that's one of the easiest types of procurement. The end users go out, they get their quotes, they provide that information to finance to create a purchase order for them. The next is a request for information. That's something that we put out a formal solicitation for information when we're trying to do fact finding to determine capabilities of potential suppliers. We have a request for quote. That is another formal solicitation when a department may know what they want, but they don't know who's out there that can provide that. We'll put that out, and all of these are put out. The formal ones are put out through Electronic Virginia, or also known as EVA. It's the electronic procurement system of the state of Virginia, or Commonwealth of Virginia. And so we'll put that out, and then it's usually something that would not require a contract. So once we get the quotes back, we can generate a purchase order, and those are under $5,000. If there are items that we need that are going to cost over $50,000, I said 5 before, 50,000, invitation for bid. We put out a formal solicitation for bids, and the awards are made solely on price to the lowest responsible bidder. Then we have cooperative contract where we can write off of other localities or state contracts. Some of them, depending on the language, may require that we just have to do a purchase order, or we may have to generate our own contract from that contract. Then we have sole source. This type of procurement is a little bit difficult. It has some research to go into it because in order to qualify as a sole source, you truly have to be the only provider who can provide that service. May not be the name brand or that you want, but it could be provided by someone else. So there's research that goes into that. Emergency procurements. This can be used on intermittent basis when the need arises. If the cost is less than 50,000, we can do a emergency justification. We like to do confirming purchase orders, but that doesn't always happen. Lots of times finance doesn't see it until after it's already the service has already been provided. And then we have had emergency contracts where we need to have a service and we need a contract because of the dollar amount that's involved in it, and we'll do an emergency contract. And then we get into the more lengthy process, which is the request for proposal, which you put together a scope with the end users that gets posted out there, usually for a period of 30 days, sometimes longer. You have to allow for questions to come in, and that's all fielded by that procurement person. And then they, after the date of closing, there's a formal opening process, and interview committee or evaluation committee is selected and evaluates all of them based on the criteria in the RFP. And then they will schedule interviews with the selected candidates. And this is this type of procurement is not just based solely on price, but it's also based on experience, the proposal, the approach to the project. So a lot of different things go into that. And once the committee makes a selection, there can also be negotiations with one or more selected companies. And when we finally make that final selection, that's when we come to the board and ask for a to generate a contract with them. And then the contract gets put together, goes to legal. After it comes back, then there can be some back and forth between the company selected and the contract. And then we have multi-award RFPs, like earlier last year, we had the multi-award for the professional engineering services. I think we did to 7 different companies. So that was 7-fold that legwork there. And then the next page just had some data that we collected showing you the increase in purchase orders that I did over the last 4 years from fiscal year. The purchase orders the records are kept by fiscal years. You can see in fiscal year 21, we had a 46% increase in the number of purchase orders that were generated from the previous fiscal year. On the same calendar year, 2021, we had a 47% increase in total solicitations. And as you can see that there are more leaning towards the, excuse me, the more difficult procurements. Right now, we have already gotten into 5 this year, and we have 11 that are in the works right now and have not been advertised as of yet. So you can see with the amount of work that procurement is involved with, as the Director of Finance, I'm being torn between the finance items like budget as well as procurement. And so I would like to hire a procurement manager in the next fiscal year. Thank you.
Any questions?
Yes, sir, Mr. Chair.
Mr. Collins?
What's the expected additional revenue this year?
At this time, we do not have those numbers. There are a lot of factors that go into revenue calculations. This is for the General Assembly, this is the year where they meet longer. So we do not have any estimates yet from the comp board as to what we're going to get for there. We're still working out numbers, looking at the reassessment property values. And so that's an unknown. There are still a lot of unknowns as far as the revenue. And as I mentioned at the last meeting, we probably won't have any true numbers until later towards the end of March, especially like also for personal property. The Commissioner of Revenue's office sends those off through a valuation system, and then they come back, and we, at that time, we can assign what the rate is and look at what the numbers are.
So, not to ask the question again, but so the schools and other entities have an estimated amount of additional funding. Schools is 4 million. Certainly we have some estimate besides the assessment situation and the sales tax and so forth. Surely there's some number that even a minimum number.
Well, we certainly can provide you with something that's based on where your current tax rate is right now, and with what we think that the revenue might come in at. But that's going to be a guess, because you all have to make that decision about what the tax rate will be going into the next fiscal year. It's my understanding that the board has always done that kind of process at the back end of this budget process. So what you're asking for would be something that I guess I need direction from the rest of the board on, about how they want to proceed with that. Because we're following the script that was laid out in previous budget work sessions. And in no disrespect, I'm just saying that's where we are. And I think what Ms. Hahn is saying is we were thinking that towards the end of March, that's when we start throwing the revenue knowledge information to you that we have available.
Do I get another turn, Mr. Chair?
Wait a minute. We have some other questions here. You can follow up here in a minute. Skupka?
Yes, thank you, Mr. Chairman. So Ms. Hahn, so basically what you're saying, because I know the Code of Virginia requires us to have a purchasing agent. So right now you're also wearing that hat. You're the one, you are our purchasing agent that we're required to have by code, and you swore an oath and took out a bond, right?
Yes.
And that's on you. So if we hired this procurement manager, would you still be the purchasing agent, or would this procurement manager be the
take that.
purchasing agent? Okay. So then next question, you have 2 procurement specialists right now, right? Already on staff. Without saying anything disparaging or making you make a judgment about staff, do either of them have the tenure you would expect, the tenure in their position that you would expect a purchase or a procurement manager to have to move someone up from within?
It's possible by the beginning of the fiscal year, but right today, no.
Okay, or you may have to put out an outside advertisement too. Okay, thank you very much.
Mr. Granger?
Thank you, sir. Ms. Hahn, so you gave quite the timeline in regards to people coming in, people retiring, people moving on. Could you boil it down to what's the delta? Like, what was the staff at 2019 total and versus
Well,
now?
in 2019, it was 1 procurement staff and some assistance from the school's payable position.
Okay.
But prior to that, when there were less procurements, there were 2.5 staff members
Okay.
that did procurement. So,
But some people have moved from that procurement spot into other spots to backfill those roles. And those roles were vacated by other people, I assume, or were they?
So one of the procurement managers, I don't know if she retired or she left the county.
Okay.
She had an assistant that had been working with her for 6 years and became the procurement manager. And then in 2018, she left the county, and there was no understudy per se. There was no assistant.
Okay.
At that time. She had a part-time, a person whose duties were split between that and something else.
So when she left, did we not backfill that position?
That position was actually backfilled with Levita.
Okay.
And then Levita moved up to accounting manager and training last year.
From procurement.
Yes.
And so then was it backfilled again?
And that's when it was backfilled in January of 2021.
Okay. And so this is an additional one on
Specialist and
top
not as
of,
the manager.
of what you've always had.
The procurement specialist took the place of a procurement manager.
Okay.
And was in training, so to speak.
Okay.
And because of the learning curve, and I also possess a Virginia contracting associate and have done procurement for the Commonwealth of Virginia for many years.
Mhm.
I stepped up to take on that additional role. But for anyone who knows me, I'm here early in the morning till sometimes late in the evening. And after a year, it's taken a toll.
Yes, ma'am. I understand and I appreciate your service. So you said there's 2 procurement specialists. Hiring a brand new procurement manager with 2 procurement specialists is what you're looking to have to be able to execute all the job. Is that my understanding?
We look at the numbers and it's increasing, and it's possible that at some point we won't, once we get someone who devotes full time to that position, that it's possible that we won't need those. But as that is growing, the other places in finance are growing as well, and
You would look to then reallocate to
possibly
other
reassign.
positions as well.
Yeah.
So that's what I was trying to figure out if those positions weren't needed. How does that work out then?
It's right now I really could use 2 more positions, but I'm only asking for 1.
What's the other position you could really use?
I really need an accountant to work under the accounting manager.
Okay. Thank you.
Mhm.
Mr. Jones.
Mr. Bender?
If I could add to, so we know that y'all have had a proposal that's been discussed and the Service Authority has discussed it about the idea that you might merge and create a public utilities department. I know that's not set in stone. It's not, both boards have to act. But in one respect, the finance department has been much more involved in the procurement aspects of things at the Service Authority. And we only consider that something that has to continue for the better management of their financial operations. And so that's one element that they're getting much more involved in.
I just want to go, is this the going rate to get somebody and does this position need somebody who's certified or licensed?
This is comparable to a lot of the first line managers in the state. And that's where I came up with that number at. And in the state, you have to have at least a VCA to become a procurement manager, entry-level procurement manager, and then work towards the Virginia contracting officer, which is a VCO, and possibly even a VCM, which is a Virginia contracting manager.
So I asked that to just show that it is something that you need licensure. It's not just,
Yes.
The entry-level position.
Right.
Mr. Chair, I just wanted to make sure to our committee members, if they have a question, can ask too, so if it comes to time.
Citizen Board, any questions? Mr. Collins, you said you have another one?
So on the board, you have new position discussions. We're kind of putting the cart before the horse because we don't know how much additional revenue will be available. But if you were to rank these between 1 and 2, I would rank the sheriff 1, the EMS 1, and the rest, that includes the deputy fire inspector, as 2s. So I think that we need to work on our core services and then do the fill-in behind them. I understand you need support personnel for these, but we need to find out what the revenue is before we get too far ahead.
Thank you very much for wearing those two hats for what you do. Yes, you are here quite a bit. I was just trying to keep track when you were talking, Mr. Granger. Sounds like we were down like 2.5 positions, but you're back up at full staff.
No, in the beginning of fiscal year 21, finance lost 2 positions.
So you're down 2.
Down 2. But along with that, the ambulance billing went to EMS as a full-time position over there. That EMS person also did other finance work as, included. We also had the muni billing came on board with the service authority, but that's something that down the road, not right now, that may be coming back in-house once we get our financial system up and going. And then the CSA coordinator was reallocated to the Department of Social Services. And she did not just do at finance, she just didn't do CSA, where now she does at Department of Social Services.
I guess that answered my question. But
So
I know there's different people, but are you at
we
full
lost 2
staff now?
positions, but we didn't. So at what we are allotted, we are at full staff.
Right. So this is going to be a new position, the manager's position.
Yes.
For your staff.
Yes.
Okay. Now I got it. Thank you.
And so are you ready to move on to the next position? And that would be Mr. Miller.
Okay, so we've had a lot of discussion about a public information officer, and this is really a placeholder. I don't know, to be quite honest, are we going to be in need of a $70,000 salary with, then benefits almost $100,000? I don't know that. What I have talked about with y'all is doing an RFI, to get somebody to look at things, to give us some information. We can pull from other communities about what they're doing. I do think that if we are going to go down this route, then, we want this position to be kind of the centralizing public information source. And I know that's going to be marrying what sheriff does, marrying what fire and rescue does, marrying what the tourism and economic development do. And so that's something that we would want that to happen. I think there's been discussions with Mr. Dines about with this, a webmaster, somebody that's going to maintain. Right now, that's Chris Dines, and I mean that's kind of, this is a gentleman who's running a major department, and we need to move that out. So that's something that this position could have that level of responsibility. I think the other thing about this position would be your social media, the content, to providing that, keeping up on, things like that, and working with you all if you have your social media needs, helping you in that respect, because I know that that's the way people are communicating. So that's our plan, and so that like I said, there's a lot of positions that we have needs for. I'm not saying that this is not a need. I'm saying that the 70,000 could be lower. It could be in the $50,000 starting range. I just don't know yet, and I just wanted to get that in as a placeholder. We could, I think if somebody came in and did some analysis for us, it might take beyond your budget, adoption process. So. I think we can always bring it back if there's some other position that really is critical in this list of positions. I understand it's not going to be something that, but I know that there has been discussions by some of y'all that want to see this position, and I would agree that we do need a centralizing approach to how we do our public information. I'll answer any questions.
Questions? Ms. Kupka?
Thank you, Mr. Chair. So I feel like at the last work session, we talked about the possibility of doing a staffing survey. I know there was the suggestion that we do a comp and pay study again, because the last one that was done was, I think, in 2017.
Yeah, that's something that's coming in future discussions is the, the request to do a salary survey for all of our positions. And so, yeah, that's something that we have to present to you later.
So I'd wonder if my colleagues, if there'd be consensus to actually, as part of that salary survey, do a staff analysis to determine the need for, if there is a need for this, or if there are other positions also that there may be a need for that really haven't been identified. Would that be something that the board would like to see come out of that survey as well?
Sure.
Mr. Chair, I have one add-on to that. On that idea is to also make sure that, I know we've always talked about our pay being comparable, but part of the survey may be looking at the other localities for certain positions to make sure that we are comparable so that we can attract and keep our employees.
I'm amendable to that. Mr. Collins?
Just explain to me that one more time.
Sure. So you'd be looking at not just doing a salary survey, which was what was done in 2017. So a salary survey takes all of the positions, all of the job classifications that we have in the county, and would do comparables to, the region or similar sized counties. I feel like it may be, Amanda, you can correct me if I'm wrong, in 2017, wasn't one of the comps Caroline County? I thought so. So you not only be doing like a salary study to see where we come in for the positions that we have, but you would also be doing an analysis of need to figure out what the people we have, what are they doing? Are they truly doing the things that were in their job description that they're paid for? Or are they doing more than what's in there? And would there be a need for additional positions? So I'm not saying fund the positions, but this would give us a good idea of, do we need a public information officer? And then down the road, then we fund it, instead of just saying, I think we need one. I've said that before. But maybe there are other things that we need too. And then this would give us an idea of what all of our staffing needs look like. And then, like you suggested, prioritizing, then going forward, we could prioritize them. But doing this type of study would give us some more information to base our funding decisions on in the future.
Yes, I agree.
All right, Mr. Miller,
Okay. That's all I have to say.
go forward.
Okay, next we
Yes, sir.
have Amanda Samuel from Human Resources.
Good evening once again. Let me get this going. All right. So thank you all for inviting me back to give additional information to support my request of one additional full-time staff member. There we go. Okay, there we go. All right, so let me give you a little bit of history before I dive into the support for the position. Up until 2012, there was no HR department for the county. So when I was hired in May of 2012, the HR department was established. For 4 years, I was a department of one. And then in May 2016, we hired a part-time HR generalist who is Tamika Craft, and she is still with us today. In October of 2016, I actually shared a part-time person with the board. They had an administrative assistant who worked with them, and then she also worked with me for about 10 hours a week. And that was Shayla Candelaria. She is still with us today. Her position was actually converted to a full-time position in July of 2018. And then last year, in July of 2021, we added one part-time HR specialist, and that is Susan Courtney. All right, so that's the way we currently look with Mr. Miller at the top, myself. Again, I mentioned Susan, Shayla, and Tamika. So if you notice there's a difference from what I just said. So in January, Susan and Shayla switched their status. So Susan was part-time, looking to be full-time, and at that time, Shayla was seeking part-time. So those two just swapped. All right, I wanted to put this up. I know it's rather small, but just to give you an overview of our areas of responsibility for the HR department. I won't go into every single block that you see there, but if you look at recruitment and advertising, employee relations, benefits administration, payroll, VRS, employee programs, HR policy and procedures, unemployment benefits, workers' compensation, records management, and employee disputes. So basically, I just wanted to show you guys that our plates are full with the staff that we currently have. And again, I'm not going to go into all the additions under there, but just to give you an idea of what we're currently doing. And so now I want to get more into why I'm requesting one additional full-time staff member. So last year I stood before the board and I requested a full-time staff member, taking into consideration that there were others who also could requested full-time staff members as well. So I was awarded a part-time staff member with the caveat that if that didn't work, didn't resolve the issues, wasn't enough for the department to come back. So I'm back. I definitely appreciate the part-time addition. Again, Susan has been a godsend. She's been an asset so far. She continues to learn and grow. But even with the addition of one part-time staff member, we still see that there are areas of deficiency. As Mr. Miller referred earlier, that there's the possibility of adding additional departments to the county, or at least the county's purview. One of those is the Service Authority. And currently we do service the Service Authority as much as they will allow. I'll just say that. So if we took on the Service Authority, of course, that would increase the workload that we have. We would have full overview of recruitment, their hiring, training, compliance, safety, compensation, and also their performance reviews. In addition to that, you'll see DSS is listed there as well. So the current director, Jonathan Franklin, and myself have started discussions for a possible deviation of Department of Social Services. And what does that mean? What does that look like? So currently, they're really a hybrid. So we pay them, we manage their benefits for them, but there are certain areas that we do not manage, and they're considered state employees, if you will. For advertising, when they have a vacancy, they have to notify the state. It is a long and drawn-out process. They have to notify the state, and then they have to advertise and go through their process. There are several layers of interviews that they go through before possibly even coming to the director and his staff to be interviewed and then to bring them aboard. So some of that could be cut, the time frame to actually replace people or to bring new people aboard if they were under the county. Jonathan would have more oversight of that. And to say that we were consider adding them, that's of course going to add 20 more people. With the Service Authority, it's about 25 people. So you're looking at possibly an addition of 45 more people if those two departments are absorbed by the county. The second is training and development. And I know we were just talking about the learning management system. I still stand on the fact that training is super important. It increases morale. It helps to retain our employees. It shows them that we value them, and not only getting good people here, but keeping good people here. It shows them that they can advance their career here. They can get the learning that they need right here in King George versus looking somewhere else. And if we were to get the learning management system, we would need to have a person to manage that system. Again, it would be very intentional, the programs that we would develop. It wouldn't just be a free-for-all. So we would definitely have to have someone to manage that. And I'm proposing that in addition to not only managing that we have this additional staff member manage safety and health. So currently, we do not have a safety officer or anyone that covers risk management. And that is something that we really need to rectify as soon as possible. Safety is very, very important. We want to make sure that we have a safe environment for our employees, that they get the proper training. And if we do that, that can reduce the cost of workers' compensation claims. It can help improve the quantity and quality of our employees while they're here. And it can also increase morale. So again, training development departments, but also safety and health. This additional person could be that safety officer, and to ensure that we have compliance, that they could work with departments like the Service Authority to make sure that they get the training that they need. And if it's something that working with other departments such as fire rescue, working through the learning management system, or even getting outside training to make sure that we're in compliance as far as safety and health. And then the last bullet I have there is just succession planning. So Mr. Miller and myself have started a discussion as far as succession planning, but to this day, we really don't have a plan moving forward. And I really feel that that is a key to future success for our organization. We have baby boomers that have left. We have baby boomers that are leaving. Some have 10, 15, 20, as Donna mentioned, 33 years of experience when Barbara Howard Johnson left. So we need to develop a program that can help to mentor the people that we have here, that can identify future leaders and get them trained and prepared to take on the reins, to be the second in command, the third in command, so that when we have a vacancy of managers and supervisors, we have other people that can just go right into those positions. And my final justification, according to industry standards, and that has changed, I will tell you, over time. So back in 2015, there was a report that came out by SHRM, which is the Society for Human Resource Management. And they reported an average of 2.5 HR personnel for every 100 full-time employees. Again, that was in 2015. That was some years ago. So I found a more recent study, according to Bloomberg Industry Group, HR Department Benchmarks and Analysis. The rule of thumb for the ratio is 1.4 full-time HR staff for every 100 employees. King George currently has 2 full-time staff members for HR and then 2 part-time staff members. So if you look at the numbers there, we have 470 employees. That's going to actually increase to 474 because we just hired 4 new employees for the Service Authority. All right, so I provided some additional information and justification for the position, but now let's talk about money. So to hire a HR specialist, I put in a salary request for $44,000, and then with salary and benefits, that would be $65,672. I'll be honest, I've looked at some of the numbers. To hire someone to be a trainer or to manage the training program, to be safety officer, we probably should request more money. However, with the staff that I currently have, I don't want to bring someone in that's far above where they are, because we currently have, again, a part-time HR specialist and we have a full-time HR specialist. So keeping that in mind, I'm requesting our annual salary of $44,000, and then with benefits, $65,672. Do y'all have any questions?
Questions?
I have
Mrs.
a
Bender?
question, Mr. Chair. Could one of our current staff members possibly do that, and then we would hire another to replace them?
So you mean like a conversion of
Mhm.
part-time to,
Yeah, that's
That's a-
just
that's a
just
pos-
asking.
Yeah, that's a possibility. And I only hesitate on that because we had that discussion during the budget meetings with Donna and Levita and Mr. Miller as well. And so that's what happened last year. And then I came back again this year saying, hey, that still wasn't enough. So if we converted one of the part-timers and then hired another,
Or even
that would give us 3 full-time employees. And then with the 2 part-time, that would be almost equivalent to another full-time. So
just ask. And does this put,
I'm trying to think of the money like in my head. So if you converted a part-timer to a full-timer, of course, you're going to have benefits that you add back in. So I don't think it's really going to adjust the money because we currently have the 2 part-timers. And if we hire a full-time, whether it's a new person or we convert, we're still going to have the part-time person. So I don't think it's going to affect the money if we do it either way.
well, my second question with that is, since this is a very detailed position, would it require, honestly, a little bit more to get a qualified person that has all that kind of training?
That is a definite possibility with the safety officer requirement, for sure.
All right, thank you.
Yes, ma'am.
Ms. Granger?
Do either the part-time people have the qualifications to serve as that safety manager?
We probably have to have them trained.
Okay.
My only concern with that is that the 2 that are part-time, that's their preference to be part-time, and I don't think that they're looking to do any more currently.
Okay.
Yes, sir.
So going back to the additional positions justification slide with the additional departments,
Mhm.
how close to reality is the DSS
That may
relationship?
that may be some time. So it does, it's not something that you just decide, hey, let's do. That's a lot of research involved. So Jonathan has started, he's looped me in and said, hey, he gave me like 10 pages of these are things that they're probably going to ask for. It's probably a year,
Okay.
2-year process if they decide and the board approves for him to go that route. So you can do deviation of certain areas, like they could only deviate with recruitment, for example. Or they could say, we're going to totally deviate and be under the county. So there's varying
So-
deviations that he could select to do.
That would be looking towards the future impacts to HR as opposed to what would be an impact this year.
Yes.
And I'll be honest with you, with the service authority, that's been at least thrown out as an idea, but I'm not prepared to step in and say that's happening.
No, that's
So,
definitely, no, no.
I don't really want to look at either of those.
And I think on the service authority though, we're doing their work. I mean, that was one of the things that was obvious is that they needed to be involved in the hiring and the disciplining and the investigations and things like that. So we're doing that, but it's Amanda. So, I mean, I think you could justify another position right now, given what we're doing with them. If the board does nothing with the service authority, then I think the question that you have to then answer is, are you going to continue to have the way it exists right now with kind of being a semi-independent? Because
No, I understand that. I'm just saying, I'm not,
no, I
I don't know if
understand.
I'm prepared to weigh that into decisions when that hasn't even been decided yet. Since it's still in flux. Let me ask this.
We would hope that you would have a decision on that before July 1, which is when this budget would take effect. So that's
Okay.
why I think we're considering it and putting it in. Right. There's no pressure attempt or anything like that.
I'm not saying there was. I was just giving, I guess, my insight on it. So I didn't feel like I was being pressured. So I apologize if I gave that impression. Ms. Sumiel, I'm gonna ask you, so last year you did ask for a full-time position.
Mhm.
The board authorized a part-time position.
Yes.
If the board had authorized a full-time position, would you be back here right now today asking for more? Another half-time position or a full-time position?
Probably a part-time at least.
Okay.
Yep.
Okay.
Yeah.
So
'Cause like
you
I
would be
said-
looking to get in the same position you're looking to get into now, which
Yeah.
would be, okay.
Yes, yes. And I don't see things slowing down at all. I
Mhm.
see the county continuing to grow. I mean, just looking at some of the requests that we have for more staff members. And as more people come in, remember, HR touches every single part from recruitment all the way to the time that they separate. It doesn't matter if you're seasonal, part-time, full-time, we still service all of them. And
I'm tracking. I was just trying to, I guess, understand the mindset, at least from that perspective.
Sure.
So,
And in addition to that, so I'll throw one more thing out there. My goal has been to try to set up a hierarchy within HR so that my ladies or gentlemen feel like they have somewhere to go. That you start out as a generalist, you move up to specialist. Eventually, I'd like to have an HR manager, but I don't have the staff that's currently capable for that. I would love to get staff and train them and get them prepared to be an HR manager, and then you have the director position. So I'd like to build up that hierarchy. I'd also like to really separate and specialize our staff. So it's really difficult trying to have everybody do everything.
okay.
So I'd like to have a go-to recruiter or go-to, so I can assign areas to these guys. And so when people call, when people email, they know exactly who to contact versus the whole group.
Yes, ma'am. I can appreciate that. And I think that makes a lot of sense, actually. So I appreciate it. And no other questions, but
Yes,
appreciate it.
Mrs. Cupcup?
Yes, please. Thank you, Mr. Chair. So you both just answered one of the questions I was going to ask with regard to the service authority. So since Mr. Miller has become the interim general manager, you have identified the need for more work to be done by HR for the service authority, and that work is happening.
Yes.
Right?
Yes, ma'am. Yes, ma'am.
Okay. And then the justification slide, Mr. Dines, could you bring that one back up, please?
Oh, that's me. I can do that. I think.
Oh, you have it?
Oh, he got it.
Thank you.
Okay.
So according to the rule of thumb ratio you presented is 1.4 per 100 employees.
Mm-hmm.
And we're at 470. If my math is correct, that's 1.4 times 4 plus maybe another 1 for that extra 70 people because it's not quite 100.
Right.
So I'm guessing ideally you would want to have for the county workforce that we're talking about that you support, I get like 6.6 employees, like 6.5 employees is really what would be ideal based on that ratio.
Yes, ma'am. But I've also learned too that, just take baby steps. I don't want to come and guns blazing like, hey, I need 3 more people. I think it's, and again, thinking about other departments too and the other needs that they may have. So if I can have one and we can deal with that, and then we can come back as needed. But eventually I would love to get to the point where, we do have 6 or 7 people in the department. So again, we can specialize, we can have the hierarchy, we can do all of those things. And if we have future departments that join us, then we're already prepared.
Thank you. That's all I had.
Yeah.
Mr. Collins, anything?
So I do agree with Mr. Granger in as far as the service authority. And, I think a July decision on that would be too early because there's a lot of things to consider. So I wouldn't want to enter those into the mix at this point. The electoral workers, 113, how much HR do they need?
And that's a good question. So when they are hired, we do their paperwork, we do their badges. Even though they may work a day, 2, 3, or 4, depending on if we have primaries and elections, we pay them, we do their pay cards. Most of them get pay cards for some reason. And so they come in the middle of the year and say, hey, my pay card expired. Can you please, set that up? I've changed my address. So things like that, even though they're not working every single day, we still are the people that they go to for all of those needs.
So given the numbers you gave about the 1.4, you would need 1 person full-time for the electoral workers.
Yeah, according to the rule. Yep. And again, that's industry, that's the suggested ratio to have a good coverage so that you can answer those calls in a timely fashion. Believe me, We work really, really hard to do all of that. My ladies work after hours. I work after hours on the weekends. We make ourselves available, but we are getting to the point where it's getting hard. So you are the employee who has applied for a housing loan. You're trying to get a mortgage, and someone has called and said, hey, I've called like 3 times. I need the verification of employment. And maybe that's not the top priority today to get to that. So I don't want that to be the case. I don't want that to be that, hey, your loan is delayed because we didn't call back with your verification of employment.
So just follow up on the electoral workers. Certainly they can't be one full-time employee to manage those folks.
Do you mean that they would manage them and only them? That would be their, so in our department,
According to 1.4, that would be true.
it is, but again, there's so many facets about HR that we're not just, if you have a benefits person, they're not just doing the benefits, they're working in other areas. So it wouldn't be that, hey, they're only working when the electoral workers are working. They would cover other areas. I would love to get to the point where, again, we can be more specialized, but currently that's not the case. I don't know if that answered your question.
We have pause, Mr. Granger.
I kind of had a question based off what you were asking, if you're amenable. Is it cool?
Cool with me.
All right. So what I heard from Mr. Collins, and because I don't know if he got the answer he was looking for, kind of what I was hearing him asking, and you tell me if you agree. Do electoral workers require the same amount of HR services as a full-time employee?
No.
Okay.
No, sir.
Okay. Is that kind of where you're trying to come at?
That was my point, sir. Thank you.
Okay.
But I don't want to just put them to the side.
They don't
like,
require
hey, you're-
no services,
Exactly.
but the 1.4 rule might not be a very good ratio to use on that subset.
Okay. And
That's
so
kinda, I think maybe the point of view.
if I could, so we're looking at full-time equivalents, and I thought that question may come up. So there is a formula that you can use to come up with full-time equivalents. So if you take that number and looking at not just the full-time, taking those out of the mix. And so I did that calculation and rounded it up. We're at a little over 300. So if you do 1.4 times for 300, then we're still understaffed. If you take those out of the mix and count them as a full-time equivalent, not as a full-time person, but as a full-time equivalent, we're still understaffed. Yeah.
Thank you for that.
Yes, sir.
Mrs. Bender, anything? Collins, do you have follow-up? Gentlemen? Thank you.
Thank you.
And next we have the sheriff.
Welcome again, Sheriff Giles.
Thank you, Chairman. Appreciate it. Good evening, Mr. Chair, members of the board, and members of the Citizens Board, Mr. Miller, Donna, Levita, Chris. I've been asked to come here tonight to discuss my request for 2 new ballots. Per Virginia Code 53.1-120, the King George County Sheriff's Office is responsible for security at the King George County Courthouse. The courthouse itself, the existing courthouse itself, is a single-story building which services 3 courts: Juvenile Domestic Relations Court, General District Court, and Circuit Court, with just 2 courtrooms. At the present time, there are 7 full-time bailiffs and 1 part-time. In order to provide proper security for the courthouse, on the days that there are 2 courts in session, it takes a minimum of 7 bailiffs. 1 at the public entrance, 2 in each court that is in session, which is the judge's request, along with 1 in each court as a runner to escort the defendants that are in the holding or waiting their time in court. When a defendant needs to speak to a lawyer, it requires a bailiff to be available to escort the defendant in and out of the holding cell into the interview room. Along with security of the courthouse, the bailiffs provide transportation of the defendants from the facility they are being held at to court and then return them. And on occasions, they handle mental transports anywhere in the Commonwealth of Virginia. The following numbers that you see up green are the transports that the Sheriff's Office did in 2021. We had 310 adult prisoner transports, 8 extraditions, 7 juvenile transports, and 53 mental transports. Not all the transports were done by the bailiffs, and some were handled by the road deputies. But some of these transports by policy, which is our policy is 60 miles or 60 minutes, requires 2 deputies. Taking 2 bailiffs from the courthouse, or if that's not possible, a road deputy will be the second with the bailiff. And keeping in mind that that is if Lieutenant Govan is staffed full and he doesn't have anybody in training, vacation, or sick. Circuit court criminal cases are up 9%, and civil cases in circuit court are up 3% from 2020. The combined courts, which the numbers that they gave me take care of criminal, traffic, and civil, are up 61.8% from 2020. The new courthouse that is being built, expected to be completed in December of 2023, has 3 floors and 3 courtrooms. To provide adequate security, it will require a minimum of 11 bailiffs, 1 in the control center, 2 at the entrance, 2 in each of the 3 courtrooms when the court is in session, which is more and more likely as the citizens in King George, the population rises. 1 to assist in moving prisoners from the holding cells to the courtroom, or be with the prisoner while they speak with their lawyer, and also to have a roving supervisor. I would like to plan to have a minimum of 9 bailiffs, if the 2 are approved, trained and ready to work security in the new courthouse. Once hired, it normally takes anywhere from 3 to 6 months to complete the training and be ready for work. If approved, it is my plan to wait until January 2023, and I think it's kind of an agreement between Finance and Mr. Miller that that we wouldn't start them until January. But I would also like to add that in the 23-24 fiscal year, I'd be able to provide 2 more bailiffs. I'm going to request 2 more to provide that adequate security, transportation, civil process, and not rely on the road deputies to fill in that gap. If all 3 courts are in session, if all 3 courts are not in session, the extra bailiffs would be used to serve civil process or other duties as related to the Sheriff's Office. This will relieve the patrol deputies from serving civil process and taking them away from handling calls for service. And just for a note, in 2021, over 5,000 documents of civil process was served by either courtroom security personnel or the deputies. So having all that in mind, I thank you for your consideration in this request for the new bailiff positions, and I can entertain any questions at this time.
Thank you, Sheriff. Any questions?
Just have one.
Sure.
Yes, thank you. Sheriff Giles, I know being on the courthouse committee, it's very important to have those extra bailiffs for a bigger court. And can you give me just, if we didn't start the process now, how difficult would it be to, once that courthouse comes open, to staff it?
I'd have to pull road deputies to be able to properly give it adequate security.
All right, thank you.
Sure. Thank you so much. Just want to make sure. So again, you profess that next year, again, you're going to come for another 2 in order to prepare for the courthouse being built. And again, that would be, I would anticipate looking at the January timeframe again for next year. Is that inaccurate? Okay. Thank you.
Mr. Chair. So though I wasn't on this board when the courthouse was approved, I do endorse that decision by this board. So given the new courthouse, it's going to be imperative not to take the folks that are on the road off the road to be in the courthouse. I think that's a #1 priority. Sheriff's Office and EMS, like I spoke earlier. And I understand when the deputies, I've done civil process myself, and so I anticipate that you'll have more civil process
As the population continues to grow, yes, sir.
along with the economic situation. And I anticipate that you'll even have more calls, much more calls when the bridges open up. So I would consider the Sheriff's Office a #1 priority if funds are available.
Thank you.
Thank you.
Something else to maybe take into consideration is if all the courts aren't being run, as I stated in the presentation, then those bailiffs, I'm going to try to, what you might call dual train, so they'd be law enforcement, so they could come out and assist out on the road during their shifts, adding to the road as well. So you kind of 2 birds with 1 stone type of thing.
They're going through the full academy.
That's what I'd like to try to do, yes.
Okay. So they
Depends on kind of their qualifications when they get there. If he's 70 years old and still wants to do a full-time job.
All right, so they would be able to go work the road if need be.
Correct, that's my plan.
Okay.
And again, planning to make sure that I have 11 in the 23-24 season. That's why I'm gonna come back again after, if these 2 are approved, doing the 9, then 11.
Mr. Chairman,
Yes, sir.
how many do you currently have on the road
Currently on the
on a
road,
daily average?
I'm staffed with 21 patrol deputies, if I'm fully staffed.
Not per day on the road?
No, but I'm staffed with 21 deputies. I'd really rather not give that information out as far as on a daily basis.
Okay. Then I guess my question will be mute if I don't have the information.
Thank you, Sheriff. Thank you for the presentation, and hopefully we can get these positions filled to help Lieutenant Govan with his scheduling and everything.
Thank you.
Thanks.
And next we'll hear from Chief Moody.
Mr. Chairman and members of the board, good evening to you, Mr. County Administrator, members of our Citizen Advisory, Budget Advisory panel. Thank you for having me. So I was asked to be very brief and be very quick, that y'all had a long agenda and looks like y'all still have more business to do. Wanted to give just a brief snapshot of what our department makeup is. This is regarding who we staff, and where we staff, how many firefighters, EMTs, paramedics we have, for the benefit of certainly our Citizen Advisory Committee or panel. Company 1 is our courthouse station right here on Route 3. Company 2 is our Dahlgren Fire and Rescue Station. And Company 3 is our Fairview Beach Fire and Rescue Station. So we have 3 stations that cover the entire 185 square miles of the county. So currently, where our funding levels are, or staffing levels are, is 8 personnel at Company 1 per shift, 5 personnel at Company 2 per shift, and 4 personnel at Company 3 per shift. We have a total of 3 shifts. And so in our department, and much like in public safety and sheriff's office, we have a very unique operation to run. And our operation never stops. So we have, essentially, we have to run a department on a very seamless basis. We have, when someone, a citizen or a member of the public calls 911, we have to be there. We have to be available. They all have one thing in common. They never say, do you have enough equipment? Do you have enough people? They expect us to respond, and they expect us to be there in a timely manner. Our recommended levels per station is 11 per company 1 per shift, 7 at company 2, and 6 at company 3. So we currently have 17 positions that staff our operations throughout the county 24 hours a day. My recommendation, my request is that we move that to 18 positions. So we're requesting 3 positions in operations, and each shift would get 1 extra position. So that would bring it to, that'd be a total of 3 positions. I'm also requesting a full-time deputy fire marshal, fire inspector, and investigator. And that's a long line to put into Donna's scale, but that's essentially what the position is. In 2011, the Commonwealth of Virginia, did a state study on our fire rescue system and provided recommendations. And those recommendations gave us 2 staffing models. And we, in turn, adopted the lower of the 2 staffing models. And of the lower of the 2 staffing models, the recommended staffing per shift was 24, and that was in 2011. So we are today in 2022, and we have 17 per shift, not 24. In that same study, they addressed the need for fire prevention activities, the need for doing building inspections and fire inspections, and the need for enforcing the statewide fire prevention code. And anyone that's lived in King George County in the past 5 years can undoubtedly tell you that the county has gotten busier. You see more traffic on the roads. We see more plans coming in for building and developments. We see homes being built up. We see neighborhoods being developed. And so there's a need for certainly growing the fire rescue department, and also the need for a full-time deputy fire marshal and investigator. The study in 2011 reinforced that, and I have in one of my slides the excerpt of that towards the end. Just very basic, talking about our call numbers. We typically, in our department, see about a 100 call increase per year, on average. Now, there's some years we'll see a spike, 150, maybe close to 200. In 2021, we ended, from our calls in 2020, almost 400 calls in addition than we did the previous year. That's a significant amount. It's a significant amount. We haven't seen, in my tenure of being in this position, which is over 18 years in the county, we have not seen that type of increase ever in those years. That's just, again, another testament to the services that we're providing the community. We also, close to a third of the patients that we see, we have looked at the numbers in the past. On our EMS, many of our transports and services are for people that do not reside in King George County. So we have seen some years as high as a third of the patients that we transport are visitors, workers. They live in the region, they live in Westmoreland County, Spotsylvania, but they're not residents of King George County. So we have an obligation to them too, a legal and an ethical and a moral obligation. So we have to provide this service. Once we get called to a person's medical illness or medical emergency, an injury, when we start rendering care, we can't stop that and say, well, there just went a car accident, car crash, or a bus accident, or a house fire, and we gotta leave you. So we still have a legal obligation. We have to stay with that patient, regardless of how much of a priority that emergency is. We don't have a hospital in King George County. So our service is becoming more, we're seeing it more as a primary emergency service in the county. And so we're being called more and more to more, we have high acuity emergencies, we have medium acuity, and we have also sometimes low acuity. And we have to provide that service 24 hours a day, 7 days a week. This is just a clip and an excerpt, and I'm not going to read this. It's in the handout. This has to do with the need for our fire prevention inspector and investigator. We're doing more plan reviews. We're doing more, we're receiving more complaints, more illegal burnings, more people complaining about their neighbors burning trash. We have calls about the hotel that I stayed at, the doors were blocked, and the list goes on. And we see that as we see more activity that's occurring in the county. Currently, we only do the state mandated inspections. And those inspections are for our public school system. We're in there annually, and most of the times they require re-inspections. So we go in, we find some violations, and then we go back. We also do all of the licensed daycares in the county. So that's all the mandatory inspections. We have not elected to do any other inspections other than that. We also do fireworks applications. We have some that we don't have many of those in the county, but from time to time we do. We have we also do complaint follow-ups, and that has been certainly an uptick over the past years since we have adopted the statewide fire prevention code. So in short, this is just a map of our current response district, and I know it may be a little, it's not sure on that. In the yellow, our Company 1 station covers from Route 3, from Stafford County line all the way to Westmoreland County line. And so that's 113 square miles in our first due primary district. We have a vision down the road to add a fourth fire district and a station in the Shiloh, in the southeastern Shiloh portion of the county. We want to break some of that up and have a quicker response. But there's no sense of us adding stations until we can adequately staff with the personnel our existing stations. And right now we're working on that, but again, we're recommendations 24. and our current staffing level is 17 for all 3 stations per 24-hour shift. One thing that I can assure you, every day, every shift, there's a reason why people that they cannot be there that day to work on their shift. They receive vacation time, they receive sick time, there's legal obligations under the Family Medical Leave Act. I had 2 employees, I have one that's still out. He tore his ACL in his knee. That happened in July. He hasn't been back. So, he's working to come back, but it hasn't come back. I had another one that had a knee surgery, was out for 4 months. I had a lieutenant that tore his bicep muscle, required surgery to repair it, was out for 9 months. So these are, outside of COVID and seasonal flus and doctor's appointments, there's in trainings, people go to training, they can't be at training the same day that they have to work. You have to have an abundance of personnel to do this business. It just takes a lot of people. So with that, I will, and the green is Company 2. That's close to 40 square miles in the first 2. The blue is Fairview Beach Primary District, and that's roughly about 33 square miles. That's in our northwestern area of the county. So with that, happy to answer any questions. Appreciate the board's patience as I give a little bit of an overview, because I know some of this you're familiar with, but maybe other people may not be. Thank you.
Thank you, Chief. Any questions? Go right ahead.
I just want to add a comment. Being a citizen, senior citizen in this county, I've had the opportunity to call up on the services of our Foreign Rescue Department. And I just want to say, the people that came to my house, both my wife and I have used the service. And the people that came to my house, we can't thank them enough for the courtesy, the capability, and the attitude that they had in servicing us. So I have nothing but good things to say about our Foreign Rescue Service. And I certainly would recommend to the board that they give them proper consideration.
Thank you. We are fortunate to hear that statement a lot from our EMS. They do a wonderful job. Since we're over there, Mr. Chapman, anything? Mrs. Kupka.
Thank you, Mr. Chair. Thanks, Chief, for coming out tonight and presenting this. So if you can refresh my memory, I feel like you did last year ask for 9 positions and we funded 6. We did 3 firefighters and 3 lieutenants.
Correct.
So you're basically coming back for the other 3 this year. It's still a need from last year, right? This is not new information. We knew last year that need was there, right?
That's absolutely.
Am I remembering that correctly?
Absolutely correct. And I will tell you, my goal is to phase things in. I know that you can't, we're a small county. I've seen other municipalities where they get into a crisis situation and they come before their boards and they need 20 people. And that's a very heavy lift. That's not my goal. And so I know there may be, you may have seen, well, Chief Moody comes back every year and asks. Every year he asks for more and more and more. You see the calls. I give you a monthly report. Those are the citizens calling us for service, and we're here directly to support them. I don't want to ask for any more than what we need. But I do need to run a safe operation, and it does need to be enough people to respond to those calls. But Ms. Kupka, absolutely, to your point, that's exactly right. I did ask for that, and also to mention, I failed to mention this in the beginning. We are asking for half-year funding, mid-year funding, and the purpose for that is because we had applied for a SAFER grant, and the federal fiscal year is different than that of the state fiscal or local and state fiscal year. And so we have to give them time to either say yes or no. And it's not an obligation, but if we funded it, if this was something that the board decided to fund on July 1, if we got notification on July 5th, well, you already have those positions. It would have to be new positions after that, because now you have already funded that and they started. So that's why we pushed it out to that 6 months. Also, it lessens a little bit of the load on the budget as well.
So another question, I know from seeing the calls, the addresses, so we now have, you mentioned the fact that we do not have a hospital here in King George, and that you're having to transport to Fredericksburg or Spotsylvania or Stafford hospitals. We now have another new urgent care down there on Route 3. And isn't it an extension of the one that also has the office in Dahlgren? So now we have 3. We have one in Dahlgren, we have one Mary Wash down in the Journal complex down there, and then the new Peds Plus Center Care in front of Food Lion, right?
Correct.
So
and the Minute Clinic.
Yep, and the CVS Minute Clinic, right? So I notice on the call log that you are routinely called to render assistance there because people are going there seeking medical treatment that probably is an actual emergency that requires emergency room assistance, emergency room standard of care. So then you're having to transport people who are already at a first level of care to the hospital. Am I right?
Absolutely.
And how many times a day do you think? I mean, I've seen some days that happens 3 or 4 times a day, but on average, how many times a day do you think that's happening? A lot.
I would say between all of them, probably close to that 3 or 4. And there's some days it may be 1 or 2, and then you pick up another day, you get 6 or 7. But between our urgent cares and also our nursing home. Our nursing home is a heavy lift on our department. I could take 2 units in the county and just dedicate them to the urgent cares and the nursing home, and that's all they would do. And that would be 12 people.
Gotcha. And then one last question. So the board previously has adopted a data center ordinance and a solar ordinance. And it's my understanding from when we did those things, we had you come answer some questions, and I think I asked specifically, but all of those and the battery ordinance and all of that kind of technology that frankly may be interested in locating here in the future, that's going to require, in addition to the plan review that you're already doing for other structures with community development, those are going to require some more specialized analysis and needs as well, right?
Absolutely.
Okay. Thank you. That's all I had.
Mr. Chair, over here.
Mr. Collins.
First round. So Chief, how many people on a rescue squad at a time?
An ambulance, just make sure we're.
Yes.
Ambulance. You have to, 2. The short answer is 2. You have to minimum have a driver, And you minimally have to have an attendant in the back.
How many on a fire truck minimum?
Minimum 3. We try to strive for 4.
Okay, so that's 6 right off the bat. How long, generally speaking, is a from a time of the call to the time you get back to the station, including the transport? Today you had 12 transports. So how much time generally elapses between the time you roll out of there and the time you get back?
2 hours,
2 hours.
sometimes longer.
Okay.
That's from the time the alarm sounds, we respond to the call, treat transport to the hospital, do the paperwork, do the cleanup, do the patient turnover, exchange the drug boxes, clean the ambulance, fuel up, and back in the county, ready for another call.
So that's just one call.
One call.
Okay. So these EMS workers, your medics, firefighter, EMT, make sure I get that correct, you're asking for are first line folks.
Correct.
So the numbers don't really add up because you get more than one call at a time from my experience. So I haven't seen too many, what do they call it, requests for assistance. Mutual aid, thank you. I haven't seen too many of that, but I'm worried that that's going to occur, especially with increased population and increased traffic with the bridge. So I would still consider the fire EMT medics as a #1 priority if funds are available. Though I don't disagree with your fire inspector, I wouldn't put that at a #1 priority. I think first line care is the big priority. So when I call the rescue squad or fire department, and I'm not trying to be disrespectful, but I don't want a fire inspector. You know what I'm saying?
Absolutely. I would agree with that assessment. If I had, I think if you were to lay out the priorities, responding to the 911 calls is a priority.
Thank you, Mr. Chair.
Now, Mr. Granger.
Sir, thank you. Chief, thank you for coming out. I appreciate the information. The deputy fire inspector, is that needed to continue to just be able to meet the minimum inspections, or would that allow you to expand into doing more inspections? And if so, do you have a plan? Like, how much would that? I don't know how to quantify that, but.
So what our vision is when we look at what's taking place in other localities, is you would have a fee structure, just like our fee structures in community development. But right now, if a hotel has a sprinkler system and they have an automatic fire alarm system, we don't do any inspection on that. We found some that haven't worked for probably years. Okay? So it is up and incumbent upon the building owner to do that. And oftentimes we'll get a complaint follow-up and we go in, and now once we do the inspection, we don't just inspect the blocked exit, we also look, say, do you have records for when this sprinkler system was inspected? And we will sometimes find problems. What my goal would be is to, as we're seeing more commercial development in our county, is to get into these businesses and it be more from a public education standpoint. Our commercial kitchens, and looking at the hood systems. One of the things that we know is when a business has a devastating fire, it's 80% likelihood they're going to come back into and come back to a business. It typically doesn't rebound. And so from an economic development standpoint, from a if we can prevent the fire from having to respond to a 911 call, that's what the mission is of that position. And we're doing it currently to some level, but not at the level that we would like to. I think a lot of this position could be paid with a fee structure like some of our neighboring localities. I think we're there. I think that there's a lot of things that we're not doing for inspections that has some vulnerability in our community. You know, we're getting more in the response aspect, but what if we could have been in there to ahead of time to mitigate, you know, and make sure that their life safety systems were working properly. Right now, we're not doing that. Once the building official provides a certificate of occupancy, there's no other inspection. If they do an inspection, then it's just up to, it's up to their company or up to the owner.
Is there any way to analyze the calls that you have had in order to determine, this is because you brought up the idea is preventative, so if we don't have to answer a call, that's one less call that's got to go out for. Is there any way to analyze the data you do have to see, hey, we have had this number of calls that could have been prevented if it had just been properly maintained, or do you not have enough granular data to be able to come to that conclusion?
I certainly don't have the data tonight.
Understood.
It's something I could go back and really, you know, take a look at. I don't know if I'm not sure. I'm not sure if there's there's some metrics there. There's some data available. I don't think we could, you know, we could probably hone in on maybe over a 5-year period.
Okay.
But one of the things that you know, to certainly take in mind is it only takes one bad incident to be really bad and to have a high life loss in this business.
Mm-hmm.
And even though, you know, there hasn't been, you know, a fire in a 3 or 4 story wooden hotel, you know, or something of that nature, things can turn bad. You have the right recipe of hazards with winds and fuel and lives, and things, you know, there's always that vulnerability. I don't ever want to discount that, you know, that portion of it, but it's something I could certainly try to work on and come back to the board if you'd like to.
Yeah, if you have some way to pull, I appreciate it's not going to be perfect, but you know, some kind of estimate that helped quantify to me the value as well. You mentioned a fee structure. How would that go about? How do we implement? I'm just not familiar with.
You have an ordinance right now that already allows you to promulgate fees for fire prevention activities. We would come up with an inspection, what we would require inspections for, like on an annual basis. And then it would come to the board, a fee schedule would come to the board, and as a board, you would agree and adopt what that fee schedule would be. Right now, we charge no fees. There's no fees for nothing. You know, we don't. In fact, we're probably the only locality that does a fireworks application permit with no fee. And I have some people that, you know, that even the company the county has, you know, that's done it for the celebration events and July 4th events. They're like, there's no fee? Or is that because it's for the county? I'm like, no, there's just no fee. You know, we've never adopted a fee. We don't have that many. We've had one in the river that's been in Maryland. We have one at Rick's. That's Virginia. And then we used to have ones on the base that wasn't in our jurisdiction. So.
So I know this isn't to deal with the budget per se, but would the board be willing to entertain a discussion? Awesome. Okay. I'm not saying we have to make the decision tonight, but could we I'm asking, could we add it to like one of our board meetings coming up and have a discussion about whether we would want to move forward with a fee structure and implementing that?
Well, if I may, Mr. Supervisor, it would be also a time when we deal with revenue to come back and give you that kind of information, because I think that's where you could adopt it through your budget and do whatever. If it's already in place, then it's just a matter of saying you want it in your budget, and we would show you what we think could be a revenue total from something like that.
I would be interested in that, and I don't want to speak for my colleagues. Would everyone else be interested in entertaining that? Okay.
Mr. Chairman, speak in regards to that.
Finish, Mr. Granger.
I'm good. Thank you.
Mrs. Bender, you have a
I
question?
do, but he can ask his first and then I come back.
Collins?
In regards to the fee structure, I would hope that the fee structure would only be based on commercial or not schools or public buildings to be included in the fee structure.
Yeah, I would, that was our vision as well. Yeah.
And I have one more thing, if I may. So while you're speaking, I just showed Ms. Kupka the 911 call that rescue squad just went by. Just went to the patient first for chest pain down here. So we know there's two EMTs gone right now trying to save someone's life, and they're heading to the hospital. So I think that helped bring into the fact that these priority positions. Thank you.
Mrs. Bender?
I just have one quick question because my colleagues have asked some of the questions I had. Is if we've talked about adding a ladder truck, how many positions are needed on a ladder truck?
That's typically 12
12.
for 3 shifts.
Okay.
So 4 per shift times 3.
Because understanding it would only be at one of the stations.
Correct.
Because it takes a space need. Okay.
And that is an operation you really need to have good 4 people on that vehicle.
And of some of those 12, I would assume that some of them would have to be specialized, correct?
Yes, there is specialized training for that operation. Yes.
Okay. Thank you.
Thank you, Chief. I have a couple of questions. I get to ask mine now. Deputy Fire Inspector. I thought Lieutenant or maybe Captain Dixon was doing that for years and years. Is this another position, or is he moved from that position, or?
So Chief Dixon is a battalion chief on B shift. He's a shift commander for B shift. What we're currently doing is I wear a piece of that hat. He wears a piece of that hat for fire prevention. So I am your fire marshal along with your fire chief by code. Myself and Chief Dixon we are the only 2 allowed by ordinance that can write summons. We have summons powers through the ordinance to enforce the statewide fire prevention code. We're all doing different. So his main job is not that. His main job is being a shift commander, battalion chief on B shift. So he does not do. He's doing plan review. I'm doing plan review. I have Lieutenant Cook doing some plan review, and then also complaint follow-ups and school inspections. So right now we're kind of multi-sharing amongst about 3 or 4 different people in the department.
I always thought we did have a fire marshal, like a dedicated fire marshal.
Never have.
Okay. That was my next question, was the enforcement aspect of it, because it's funny that we're talking about that now. Monday I was in Fredericksburg and there was a gentleman in full uniform with a vest on and a gun and gear belt carrying a clipboard going restaurant to restaurant. On the back of his ballistic vest, it showed fire inspector.
Yes, so so City of Fredericksburg, I think, has 3 or 4. Stafford has 5 or 6. Maybe 7. Spotsylvania has maybe 5 or 6 or 7 at this point. Some are just inspectors, and that are what's referred to as not sworn. And then there's the full sworn. And right now we don't do the law enforcement aspect. We stop at the summons power. So we don't carry firearms. The Virginia Fire Marshal Academy does that training. We have the authority to do that, but it just hasn't been our priority. What we are trying to do is to do, again, a multi-part inspection, investigation, a fire investigation, say I had this fire started in the house, we need to investigate it. We work with the insurance companies as well. We have code complaints, building inspections, and then also, you know, again, there is the enforcement part of why there needs to be I guess the law enforcement with other counties is because they write a summons and you're dealing with the public. And the public sometimes can be very violent. No. I don't have to explain that to certainly three of you, but that's the reason why that's why that authority and that training is provided. So if you see a fire marshal that's carrying handcuffs, makes an arrest, they have the authority, they have and the powers, the police powers to do that, and it's for those reasons.
Okay, thank you. Gentlemen, questions?
So yes, I do have one, and this actually follows on with Ms. Bender's question. So if the county does elect to bring in a ladder truck, do any of our facilities, would that truck currently fit, or would it require additional facilities?
It would require a different station to put that in. We could probably fit it in Company 1, but there would have to be maybe some building modifications. Our Company 1 station is our largest, and it's pretty much maxed out. What we would envision is if we once we construct it and replaced the current Dahlgren fire station off of Dahlgren Road, Company 2, that we would design the new facility to be able to fit one in the future. Yeah. Yes, sir.
Anyone else? Seeing none, thank you, Chief.
Thank you for your comments, sir.
Okay, we have one last presenter for additional position request, Mike Muncy from General Properties, and he also has been requested to do his line by line. So we're going to let him do both at the same time. And I believe you all should have gotten the summary sheet of his budget.
Good evening.
Welcome, Mr. Muncy.
Thank you. Good evening, Chief, Chairman, Board, everyone else. I'm here tonight to ask for two positions. Currently, right now in General Properties, we have two guys in maintenance. Have two groundskeepers. The rest of the people work in the parks. Come July 1st, I'm losing 4 of those employees to the parks. So I'll be down, like I said, several employees. I'm looking for a maintenance technician, someone that I can split these two crews with, is what I'm hoping. Come fall and winter, I pick up the 2 grass keepers because, you know, it's slowed down. That way, they'll give me 3 guys on each crew. So. And actually, one of the positions, I've got a groundskeeper right now that I want to move to maintenance, and that's why I'm asking for another, groundskeeper. So I'll still have 2 groundskeepers and additional in the maintenance. Any questions?
Mr. Chair, I have questions.
Mr. Collins?
So how many groundskeeper do you have now?
I have 2.
2. How many custodians do you have now?
Oh, gosh. That doesn't really come into the equation as far as maintenance.
Do you supervise the custodians?
I do, yeah.
Okay.
I have there's 19 including myself.
Okay.
All together, maintenance, groundskeepers, parks, and custodians.
And how many supervisors do you have?
Myself and one other.
2. So a groundskeeper, what is the starting pay for a groundskeeper?
$31,000.
And what is the starting pay for a custodian?
about the same.
So not that I disagree that you need these folks. I am more concerned about the existing employees. 31,000, you can make more at Sheets.
I know.
And so that's budget matter I think we need to address.
Yeah,
Even though I don't disagree that you need more people, I see them out there working all the time. And they're also doing, whether you agree or disagree, I see them on water authority property all the time, taking care of trees. And
taking care of the storm damage here the last couple of weeks.
so my first concern would be to pay the employees we have a living wage. And then second would be to have additional employees. Thank you.
Thank you.
Mr. Granger?
Yes, sir. Thank you. Mr. Muncy, thank you for coming out. So you have your budget request as well. Are those positions already factored into the budget request, or would those be added on?
They were factored in.
We factored them in to what you're going to.
Both of those are currently factored in. So correct me if I'm wrong, but last year the budget approval for general properties was $1,960,000. This year the request is $1,989,000, which is a little less than 30,000 total. But you're also asking to add 2 people, which would come to about, with salary and benefits, $130,000 delta. So I guess it's not necessarily about the positions, but where are those cost savings
Could
coming
I
from?
answer that
Yeah.
for Mike? So he mentioned that he has 4 Parks employees who are moving over to Parks and Rec.
Yes, I apologize.
And that is all those moves are factored into the sheet that you have in front of you.
Also the vehicles, the insurance, the fuel.
Jackie, that makes sense.
Everything
I
with
apologize. I
them
didn't put it together.
Yeah, I think it's important that, so, there are things that have been, and Mr. Collins correct, the general properties has done things at the service authority and those things that we're trying to get sifted out. And what I wanted to do with Mike and his department was, we know that the turf maintenance, the maintaining of the parks and things like that, the fields and the lawn are moved over to parks. That no longer is a responsibility of general property. So that's now over, it's going to be over in parks effective July 1. So what we also wanted to do was try to beef up what his operations are, because one of the things that happens, and I mean, I think I can speak for it. I've seen it. These guys are overworked. I mean, you have situations where, one crew is essentially dealing with a major, like to put the Christmas lights up. That's basically, if you got something else that happens in the county, those guys are on that. They can't necessarily pull off. And so that's what we were trying to do is add to his crew, so that you could start to have a little bit more segregation. You could start having some more dual projects going on and things like that. So that's what we were proposing. And I agree with Mr. Collins. I mean, I think you could look at this department. You could look at all the departments, if you will. Our entry level wage needs to be addressed. And that's why you do have the salary survey request that we will be presenting to you, so that we would look at all of the stuff in the county.
Yeah, Mr. Chair, he's correct, and I'm glad that you brought up the salary summary thing. That's why that was one of the things that was on my radar for. So when the nonprofits were here, they were talking about basically their number was 31,000. Below is the poverty rate. So we're paying these employees below the poverty rate. I'm sure that some of them have families. I'm sure they're not all single. And when Mr. Miller speaks of the parks, moving those employees over, I don't believe that the park employees will be changing light bulbs and fixing
they won't
stuff in those. There'll be still general properties. So there's a lot of maintenance to go along with the parks, and also this building and all the other county buildings. They are putting new ballast in. You'll see them on a ladder. They'll be putting new ceiling tile over at Parks and Rec. They'll be doing hauling debris off the roadway. So I'll just go back to my 31,000. I don't think it's enough. You know,
And if I could follow up with what Mr. Collins said. So we looked at the movement of the employees from the general properties to the parks in like a two-phase process. So the second phase comes in another budget year where we start to pull all those responsibilities out of general properties employees and we put on in the parks. And so those things like the changing of the light bulbs and things like that, that'll be coordinated. We would hope that's, you know, that's where Chris Clark and the Parks and Rec Department can become where they're self-sufficient and we're not having that crossover so much because it does, you know, when you, and we all know this, and you get your little league folks to come in here, they have very, very particular care that they need for ball fields. And I'm not disparaging, these guys do a great job, but it probably ought to be resting with the Parks and Rec Department. And that's on everything. And so that's our ultimate goal, is to start segregating those duties a little better and letting general properties do kind of the general aspect of things.
So I guess it's actually more of a question for Ms. Hahn. Do you know what the delta would be on those 4 positions transferring over? So it's going to be removed from general properties budget and it's just going to slide over to Parks and Recs. And so we'll see a increase there. What is that delta to understand the total impact
We're
on this
Rita's
request?
trying to pull up right now the what those employees make that came from his, because they're varying years of service with the county.
I understand. Yes, that makes sense. It's not going to be just 4 times.
While they're looking that up, Mrs. Benderdi, would you like to ask a question?
Yes. I sat out here a lot last fall and I saw the work that your staff does and they do a lot. And that is definitely one thing that I would like to see is us looking at their pay structure, because they do a lot of work outside and inside, and they go in and out and they always have a smile on their face. Well, at least when I see them, they always have a smile on their face. So I wanted to point that out.
Mr. Muncy, so you say you get 2 groundskeepers now, they're going to Mr. Clark?
No, they'll stay in general properties. What I want to do is promote one from groundskeeper to maintenance and then hire another groundskeeper. So I would still have the 2 groundskeepers. I'm just adding to maintenance.
So which ones are going over to Mr. Clark?
The parks.
They already take care of the parks now, but they report to general properties, and that
yes,
and that is a salary with benefits totaling $219,726.
That would be
in 219.
$219,726.
So that will be in Mr. Clark's budget.
Mrs. Kupka?
Thank you, Mr. Chair. So I fully agree with what has been stated about undervaluing and underpaying your department in particular. And I want to remind the board, and I know Mr. Collins, you probably followed along last year, that we honored your department with a resolution because for almost a year, that first year of COVID, the majority of our staff were provided the opportunity and the ability to telework. And your staff did not have that ability or luxury. I will use that word if I may. You all were here day in and day out, still doing your jobs, allowing us to provide as safe a workplace as we could. And the only other ones who were also doing that for the most part are fire safety or fire rescue and the sheriff's office. Correct. So, I mean, I would certainly like to, see something done for you all too.
Thank you.
Yep.
Citizens? Nothing? What else? Okay. Thank you, Mr. Muncy.
Okay.
And I guess you're going to go through your line items now.
All right.
Mr. Chairman,
Yes, sir.
maybe to move things along a little quicker, I'm the one that asked for general properties. And my specific thing was just what I talked about was the living wages for the the living wages for the employees. So I have reviewed this budget, but that was my main concern to bring them forth, was for that, hopefully to make those salary and wages a little different than they are. And I am, one more thing, just to, in the essence of time, was the equipment. I see down there where you're down there by the landfill and your equipment, some of it looks
Yes,
aged.
it is. And a lot of it's a hand-me-down
So
from different departments.
that's a concern. If there, I keep saying the same thing, if revenues are available.
Right.
So,
Thank you, sir.
If I could add one thing that is it would be something that we'll be bringing back to you as a capital item, is the idea of possibly moving them in closer to town. It's kind of ridiculous that your general properties, which handles a number of buildings here and next door, and that they're all the way out by the landfill. And I realize space is an issue, but we are looking at the idea that the service authority has property available to build like a metal building or some kind of a block building that could replace what they're doing right now. And Mike is going to be working on that. That'll be something that'll come before you as a capital project. And the equipment. I mean, that's where we usually address equipment, is through the capital side as well. So those things will be, each department will do that. And I know that Mr. Muncy has that on his mind as well.
And two, I know we, last year we replaced a couple of zero-turn mowers.
We did.
And also, Mr. Muncy had a request in his budget this year to replace a vehicle, and we're trying to shift some of those to leases that will save the county money over time. And when the lease ends, we have different options at the end of leases. So we are looking at that throughout the county, because a lot of the fleet countywide is becoming aged.
And you'd be happy to see, Mr. Chairman, no zero turns on my budget this year.
Thank you, Mr. Chair. So could we look at, is that something, Mr. Muncy, you can get a list together for us in time for consideration of additional ARPA monies? If those are one-time expenditures, a new steel frame building or whatever it is that you're talking about, trying to relocate them, and whatever other things, if those are truly one-time expenditures and they are needs, maybe we could consider remaining ARPA funds for those.
Certainly, yes.
Thank you.
What's the time frame?
Tomorrow.
Mr. Chair, before.
Mrs. Bender.
I had brought this to Mr. Miller's attention too at the beginning when he came in as our new county administrator, because I had toured with Mr. Weekly the grounds of the service authority, since it was a former VDOT facility, and saw how big the property was. And I thought, this is silly that we're renting when we have all this land. But one thing I want to bring up, and is factored in, there's probably a little bit of a cleanup. Can that be also used for ARPA funds? Because there are a couple of structures on there that need to go because they were left from VDOT. And
Yeah, I think that it would be part of a whole project. So if you approved of something 100,000, 50,000, whatever, then it would be inclusive of whatever the site that we would choose. I think that the service authority has been always indicated as a site because it's got available property, like you said, and has really nothing to do with whether you make a decision or not to bring them in under the county or not. That's not the purpose of it. It's that it's available property because I believe
It's over 40
it
acres,
used to be
right?
at the
I think.
Ralph Bunch.
Or-
Well, that's now
Oh.
off the table. So it is a big site and it's got some opportunities there for a facility for general properties. They're a lot closer into town. Once the new courthouse is built, they're gonna be living there.
I mean, it makes sense. I mean, I toured the whole property and I was amazed that it was as large as it was. And to be renting a facility when we could just put a new building, not an expensive building, but a new building and bring everything together makes sense to me. Thank you.
Mr. Granger.
Sure, I'm sorry.
Sir, thank you. Again, this is going to be a question from staff. I know you brought it up last time. I know there's in all the budgets some costs that increase and they're mandated because you have health insurance, you have VRS. I thought you said health insurance premium. I thought they weren't increasing. Is that correct?
Health insurance premiums are slated to remain constant, I believe.
Okay. And VRS, what was, I don't remember what the.
VRS, we just got those numbers today. That's going from 9.52% to 12.10%.
I'm sorry, so 9.2 to 12.
9.52 to 12.1.
Okay. What,
And then the life insurance percentage is staying the same. And then you also have workers' comp percentages that is included in that. So those are based on industry codes. So each different role throughout the county has a different amount for that. And then as our staff ages and we bring in newer, younger staff, we're filtering out the people who are in VRS plans 1 and 2. And if you're in a hybrid, we also provide disability insurance through VACORP for the hybrid retirement employees.
do we have, I don't necessarily need to see it on each budget line. Do we know the total impact to the county budget based on last year? What the delta would be just on those changes?
We can, if we
can
don't
get-
have it, we
yeah,
can
I
have it at the
mean-
next meeting. We can have that available for you.
That's fine.
Mr. Chair. So what's the lease? How much you pay on the lease of that building?
I want to say it's like 1,600, 1,800.
1,800 a month.
Yeah.
Enough room up there at the Service Authority to put the community development. They're out of room too.
Bigger building.
Thank you.
The lease payment is $1,700 a month, so $20,400 annually.
Do we want any other questions? We want to have Mr. Muncy go through this line by line, or are we good with this, with the information that we have?
I'm good. I just had that one.
Are there any particular line items that increased dramatically? I don't have I don't know the line by line from the previous year.
The 3310,
3310?
the repairs and maintenance.
Okay.
I've asked to replace the lights here in the Rivercombe building with LEDs. That's $15,000.
Okay.
We're going to do the work ourselves. That's just the cost for the material.
Okay.
I've also asked to replace the carpet in this building, $45,000. The carpet's worn out, if you've noticed, and COVID took a really hard hit on it.
Understand. Does supply chain have any impact on you? Just the cost of any materials that you have that you?
It depends on what it is. Right now, like pipe, I'm getting ready to do the drainage line across here, and they've only locked it in for a week.
Okay.
So it's with the, I guess, what's happening in Ukraine with petroleum.
Mm-hmm.
Yeah, all those types of products are being hit.
Okay. Was there any other ones that in particular were?
I also added to replace the carpet in the sheriff's admin and patrol room.
Okay.
That's at 15,500, and then to paint the second floor, which I'd had last year, but I'll put it in again this year for 7,500.
Okay.
That's the only main things I can remember that I put in.
Okay.
Everything else is basically the same.
Understood. Thank you. I appreciate it.
You're welcome.
Anyone else? Okay. Thank you, Mr. Muncy. Appreciate it.
Thank you.
And Ms. Hall, well, sit down. Ms. Hall and Mrs. Hart, I'm sorry that if we could take a 5-minute break or 10-minute break, and we'll get to you guys as soon as we get back. Okay, I will call this meeting back in session. And Mrs. Hart, go right ahead.
All righty. Well, you got to help me out here. This is my first time here. What? 3160, I'm adding water. Do you want me to talk about each one, or those aren't changing? The only thing I'm adding is Randy and I redid our back room, and we're sharing the kitchen now, and we're sharing the expense of the water that he bought. So that's the only addition I have there. Donna, did you have anything to add?
So what Mr. Dines has up on the board is what she actually has in her budget, those line items. As you can see, she's got up here things that she has to handle in order to get her job done. She puts money aside in this line item for any appraisals that need to be done for valuation of new homes that are being built throughout the year so that they can be added to the land books. Her vehicle valuation for both vehicles and boats so that we can get a value for personal property taxes. And you just switched the page on me there. And then she also has to other things where we might do some additions, I think, to decks, porches, garages on existing structures. So those have to be analyzed as well. And the VCIN, what is that, Judy?
That's the visa, and that gives me access to look up vehicles that folks are living here and they have out-of-state vehicles.
Mr. Chairman, can I make a request of staff, please?
Yes.
Mr. Dines, is there any way you can increase the size of the page on the screen? So I mean, we don't really need the stuff to the right, the blank columns that say county admin adjust or any of that, but the body of the 1, 2, 3, 4 columns, can you make that bigger so we can?
Thank you. I thought that was just me.
No. Thank you. That's much, much better.
Are you going to have to do that for each page? So that's that line that she has. Then so go to F. Are there any questions for her on this, or do you want to wait till the end and ask questions?
I just will have one question for clarification. The $22,000 on 3160 is you're paying half the water bill?
Yes. Randy buys the large containers of water for a dispenser, and my staff and his staff share that dispenser. So now I'm going to pay half of it.
And that's $352.44 of that line.
I was looking at the 22,341.
You're looking at the total of the summary sheet
Total.
and the actual
Good water.
itemizer here. So if you look up on the screen up here, the biggest part is her, well, not the biggest part is the money she sets aside to do appraisals for new home construction that is, that are built throughout the year so that they can be valued for real estate taxes.
So it's not $22,000 for water?
No.
Thank you.
And you'll see the different items up there. Then her next one is 3311.
3310 I took out. I don't need. Oh, now the vehicle. That's for the new vehicle.
So 3311 is for next year when you should get your car back.
Right.
I don't have it right now.
So 3311, she has a county vehicle that is on loan currently to another department. And I worked out a deal with the sheriff to assist with that process. But at the beginning of the fiscal year, her car will come back to her, and that's just for general maintenance, for oil changes, tires if it's needed. If something happens in a part, something needs to be done to it. That's about the average that most people estimate, about $1,000 a year per vehicle for maintenance. And then 3320.
This is to, for boats, the access to the game and inland fishery. Stonewall Technology, which has a program we use, is called Camera Up, that our real estate department used to do drawings and that sort. And then the ID token is to allow us access to DMV. And this is various printings that we do for the real estate book, personal property book, envelopes. And then this year I have added the purchase decals that allows access to the landfill. And then I've added Ashton Potter to purchase more, excuse me, purchase more cigarette stamps. I haven't had either of those in my budget.
Mr. Chair?
Go ahead.
Thank you very much. I have a question on the last one for the vehicle decals. Is that something we have to buy every year? Or is it just we've run out?
We buy them like the last time was, I don't know, 4 or 5 years ago. Randy purchased them previously, and now that we give them out, I put them in my budget to purchase.
So they last a while,
Oh, they
is
do.
it?
They last a long time, yeah.
All right, thank you.
Then, of course, the Freelance Star advertising. And this is postage for our mailings of business license, any mailings for meals tax and lodging tax, business vehicle equipment, the credit for the elderly program that we have just mailed out, and then our land use mailings that we have. Those are our big mailings. Of course, every day we have a handful of letters or envelopes. But these are our bigger mailings that we have. And our telecommunication services, we've got Verizon, AT&T, and Verizon, and then the fax machine. Don't have any. Then the lease and rental of equipment, the postage machine, and the Ricoh copier that's in our back room.
The postage meter is actually now up in finance, but the postage meter rental is split between the departments in this building. So you'll see that in everyone's budget that's in here.
This is a travel expense that I may have going to different commissioner association groups, annual meeting, district meetings, and the different classes that are offered for my office that we can take. Stonewall technology, DPOR, and various other classes that are offered throughout the state. And of course, the last several years, a lot of this didn't get spent because of COVID, and a lot of the stuff was on computer, on virtual. So they're slowly picking back up. And then dues and memberships to participate in a lot of the meeting and travels that, you know, I may or may not do are here. And the office supplies that we have throughout the year. Born and Son janitorial supplies. That's something that Lori Gump and I split. We order these paper towels for our back rooms, and we've done that for years. So that's my portion of that. And then BW Wilson, we get paper from them real often. And then
That this looks a little low, but her vehicle is not used as frequently as the other vehicles. That's used mostly when she does use it is for cigarette tax enforcement.
And this is for county shirts for my staff. Each July 1, they get excited. They know they can buy another shirt. So we get them some shirts. And then these are different, the NADA or JD Power is what it's called now. I'll have to update that. Our books that we can assess vehicles on these are the different appraisal guides that I have. LexisNexis, a code book. The ABOS is the boat appraisal book. And then more of the NADA guides for motorcycle, used cars, new cars, to look up and value them. And I guess, and that one, I had put in the budget this year to order the desks that my the girls have are literally falling apart. They're so old. We don't move them anymore because they're coming apart. Screws will fall out. The drawer where your keypad would go, most of those are off. They've just over years have deteriorated. So I've put in, but I have changed it. We talked, Donna and Chris and I talked about it, and I put in for 5 desks, and we lowered it to 3 to purchase 3 desks. And they're a L-shaped desk, and they have no drawers in them. We have 2 in our office now, but you have to buy 2 file cabinets that go under them on each end, and that's where you can put your hanging folders. And so we went down to get 3 desks this year, and then 6 of the 2-drawer cabinets to go under them at a cost of $3,204.90. And then perhaps next year I can get the other 2. 2 of my staff already have these. And then I requested to get 4 of the LED monitors for my staff. They're slowly getting 2 monitors on their desk, and it's been tremendous for them. They can, because right now they have little bitty screens on their one monitor, where if they have 2, they can spread it out and make it larger, easy to see for them to do their work. So I just need 4 of those. I had put in for my land use department. It's a new program. The initial cost of the program is $3,000. It will assist with the lady in my office that does the land use. Right now, she has to touch every account, and there's a little over 1,000 land use accounts as far as changing the values or changing anything in there, changing the tax rate. She has to touch each account. With this program, she can put it in and it's done. And it would really save her a lot of time because she does so much other work in the office. So that's going to help tremendously. And then to upgrade it every year, it'll be a $500 cost each year to have that program.
And that was her last line.
Yeah, that was my last thing.
Ms. Granger.
Sure. Is there a reason why? So I'm going to go back to the water.
Oh.
And I know it's a really small item from a dollar perspective, and I'm not really worried about it from that perspective, but is there a reason the water in the building isn't sufficient?
I'm sure it is. Randy has already had this big containers of water with a little thing that has hot and cold water running. And when we redid our back room, my staff started using it. So I told him, hey, we're using it as well. Let me pay half of it. So that's, and whereas this past year I've been paying it and I just take it someplace else out of my budget.
Understand. I must have overlooked it before because it is a small line item. I'll be honest, from the optics perspective of saying, hey, let's bring in water.
And that's what I do. I bring in bottles of water and it's always there for anyone to use. But the girls, if they choose to use that, that's what they use.
So I'll be honest, I have a little heartburn with this. I bring in my own personal water though. I'm not asking, so if everyone else is amenable to just leaving it in, that's fine. I just wanted to bring it up.
Yeah, like I say, that's something that the treasurer's office has always had for several years.
Okay.
I didn't feel right, my staff taking it and drinking his water and not offering to pay portion. That's why it's in there.
Mrs. Kupka.
It's the right thing to do.
So is it more of a convenience thing because you don't have a kitchen on the, there isn't a kitchen, remind me, the kitchen is upstairs, right?
Yeah, we've got a microwave, a toaster oven, a refrigerator, and a nice table and chairs.
Is there a sink in the back there that you would be able to fill a water bottle with? Like I know just, so during the break, I refilled my water bottle and I did it out here at the water fountain, which it'd be great if we had bottle filling water fountains, but that's a whole nother, I'm doing this, trying to get a little,
Fair enough.
But so is it just that it's not convenient and that's why it's been done? It's not convenient to go upstairs to the kitchen where there is a sink, an adequate sink that you could.
It's there and the girls use it,
It's convenient.
It's very convenient. And they have hot or cold. So. Randy's already got it in his budget. So.
Maybe they don't like the water.
And it doesn't probably taste like chlorine, I would think. I don't know.
Thank you.
Mr. Collins, anything? Okay. Thank you, Mrs. Hart.
Thank you.
Oh, one more thing. I'm sorry. This is not an expenditure question, but I was hoping that when eventually we get on the revenue side of the house, would you be able to provide us with a dollar amount that the vehicle license fee that we pay each year? Well, once a year, because we only pay it once a year, right? We pay it in the first half, right? But isn't it like $23?
On a vehicle, and I think it's $18 for a motorcycle and
right
for a trailer, $7, I think.
So why I'm asking is because I get that people should pay that one time because they get that decal, but I do not understand why we are paying for every vehicle we have. Once we have that decal, why are we still paying a county license fee every year when we already have the decal that enables residents to access our landfill? Because that's kind of the standard. Not that the two are tied, but that's the mechanism by which vehicles are checked to enter and use the landfill. So I would like data with regard to how much revenue is generated by that. So we can take a hard look at whether that's something we want to continue, or if we made a modification in the vehicle assessment percentage, like another neighboring county did last year. You know who I'm talking about. You call your buddy and see how they went about doing that, because to me, that's a tax over and over and over again every year that we're asking our citizens to pay. And there really is no point unless you're getting a new vehicle or you need a new sticker, your sticker wore out or whatever.
Originated. Every year you needed to get that new sticker by
Right.
March 1, I think.
But we don't do that anymore. So to me,
That might be more of a question for Randy. That's where this all generated. We just kind of took it on for the landfill stickers.
yeah, I would like us to look at that when we look at the revenue side. Because to me, I feel like that's a not necessary tax that we're passing on to our residents. Thank you.
Thank you.
So you're talking about the old county stamp that used to go right next to our state inspection?
Yes. So right now they're yellow, right, Ms. Hart? They're yellow right now.
No. The
They're
dump
yellow.
sticker?
The decal.
Right, the
that
dump,
goes next
right,
to
the
your
dump sticker,
inspection.
correct.
Yes, and that, I'm talking about that sticker. So I feel like when you buy a new vehicle, yes, you should have to pay that $23 to get that license. That's a vehicle license. To me, that should be a one-time expense for that vehicle. We should not be paying every year we get charged. I'm right? Every year for every vehicle, if you look at your bill for your personal property tax, every year you get charged another $23. You don't get a new sticker. There's no cost to print a new sticker for your vehicle. You have the same sticker you had. I have the same sticker on my 2004 Suburban. I have the same sticker I originally got, and I'm still paying $23 a year to have that same sticker. Every year, another 23, right? I'm not making this up.
And you don't have to have it on your vehicle. It's only if you're going to the landfill, you have to have it on your vehicle.
But we're still paying it.
Still paying for it. I don't have one on my car, but I pay for it. But we have one on our truck because it goes to the dump.
I guess I'm just, I think we're at the same place, but I'm just remembering when we had our county sticker that we had to put in that, our county sticker that
Every year.
we'd take it off and replace it, as opposed to now you're just talking about the dump sticker now that we have on our car.
Yeah, it's a permanent decal, but we're paying $23 every year for something that we got however many years ago.
All right, I was thinking that was just that tax that was continuing, that we just weren't issuing a sticker for the county car sticker, as opposed to the dump.
That's how it originally started though, right?
Yes.
Okay,
And I'll get that figure for you.
thank you.
Thanks.
Heather?
Good evening.
Thank you for your patience, Ms. Hall.
Sir. First off, I'd like to bring your attention to the department stats. We want to thank you for allowing us 2 new positions last year of a permit technician and a building inspector. They were certainly helpful this past year, as well as the increase in our fees. So I wanted you to have those stats right there in your front and center. So we have now moved from 12 positions to 14 positions. The first line item we have is the abatement of nuisance property. This is when we have to, as a county, go in and take down a building such as what happened next to Big Dogs. That comes with a price. We in turn put that lien on the property. It goes through legal, etc. So that's the price there. Next. This was previously our contract engineer. That has now been moved to the to Travis's budget in the engineering department. Next. We have 7 vehicles, and of course they come with repairs. Oil changes, tires, vehicle repair, vehicle wash, and in vehicle inspections. That also did increase by 1 vehicle, as we have asked to lease a new vehicle this year to try and age out some of those older vehicles that we have. Next is the GIS maintenance service contracts. These softwares are what run our GIS department. We also have added our Municity annual subscription. If you remember during CIP, you approved us for this new program in which we're currently working on. So once that's up and running after July 1, we will have to pay an annual subscription for that. So that's where that comes from. Next is printing and binding. Septic pump out printing services. We were awarded through the CARES Act a large platter printer paper that comes with the cost of that paper and that ink, and that's where we have put that here. We also included printing of our new ordinances. As you're aware, we're overhauling our zoning and subdivision ordinance, and hard copies will be made available. So very similar to what we did with our comprehensive plan, and that's where that budget item comes from. Next, we have advertising for that nuisance violation. So when we do have a nuisance property, we do have to advertise in the paper. Especially that was very costly the last time we had to do that, as that person was not a resident of this country. So that's that line item. Next is postage for septic pump out program, certified mailings, and other daily postage. I think that's self-explanatory. The next is our telephone lines, fax line. Next, we have our cell phone. We have a couple smartphones. We do have 1 air card, and we also have 6 tablets, which is going to be part of our Municity program, is those inspectors will be able to take those tablets out, and as soon as they approve or decline that inspection, it will immediately go out to whomever the registered applicant is. Next is vehicle insurance. That has increased by 1, as we are requesting 1 new vehicle. Next, we have lease and rent of equipment. We have our postage meter. We have 1 lease vehicle now. We have a copy machine, and we are requesting 1 new vehicle, and we are acquiring a replacement vehicle. We recently had an accident of one of our vehicles, and we will be taking on Mr. Miller's lease as a replacement. So we have the vehicle that's on loan from Ms. Hart's office until that July 1. Next, we have travel and training conferences. Almost everyone in our department is certified or trained in some way, shape, or form. All of that comes with the requirement to continue to be certified, as well as the testing, certifications, food, lodging, etc. It's all there in that line item. The next is dues and memberships. With those certifications, we are required to have memberships to those same organizations, from planning, zoning, fire prevention, GIS, zoning officials, VASO, etc. Next, we have our general office supplies of $7,000. We're also asking for a new laminator this year, as ours is currently dying, to be honest, as well as two-way radios. When we are doing inspections in these large commercial buildings, self-service is spotty, if not impossible, and they need to be able to communicate with the other inspectors, especially during fire inspections, to make sure that those are reaching all areas of those buildings. So that's a new request this year. Next is our road signs. All of the road signs are paid for originally by the developer. They pay our department, we put them up, we arrange to have them put up, and then after that is our responsibility. So anytime they fall down, are hit, stolen, we pay for it, and that's where that line item comes from. With vehicles, we have to fuel them. We have inspectors on the road all day, every day, and we have to put fuel in those vehicles. Next is uniforms and wearing apparel. Boots have increased in price, just like a lot of other things. We are required by OSHA to have steel toe and steel shank boots for our inspectors, and those have gone up in price. They were previously $150. We have increased them to $250. That is the starting price of those required shank and steel toe boots. We also have, most everyone in our department receives a shirt with the logo. Some of you are wearing them tonight. Next, we have books and subscriptions. Some of these books we have transferred over to the electronic versions. They will be uploaded onto those tablets that we discussed, but we do have a requirement to have hard copies, especially when you go in to take a test. They do not allow you to have that electronic version, so that's the reason for those. It is also not a code cycle, so that line item went down by a lot this year. Next is other operating supplies. GIS also has a plotting printer, so that is the office supplies required for that. For our fixtures and furniture, we are asking for 4 new shelves. Our parcel files are overflowing, and we need 4 new shelves to house just what we have on the books now. So those do come with a price of $430 each, for a total of $1,720. We are requesting a replacement desk. We are trying to go through every year and replace them, as we are a product of a lot of hand-me-downs. We have 2 desks that are falling apart, one of which doesn't even fit in that person's office, so he has pieces pieced together that don't really belong together. So we're looking to replace those. The other thing that we noticed as a director is that we waste a lot of money on $150 desk chairs. They break within 6 months. But if you put a little bit of more money, that desk chair will last us years instead of 6-8 months. So we're asking for $350 chairs to start out with 7 this year, which was reduced to 3 by budget and county administration. Next, we have the printers that will go along with the tablets for the inspectors. These are the printers that go into our inspectors' trucks, so they can immediately hand a ticket for someone who may not want it emailed to them. And that is all I have for you.
Questions? You did such a good job. There are no questions.
The way I like it.
Citizens, questions?
Well, it's not about the budget, just the stats. Do you have, so you have 2022 blank, at least from a numbers perspective. Do you have any of those numbers? Just kind of curious to see where we're at.
Of course, January is always slow in our department. It's kind of a reset in the development community. Of course, I can't put my hands on it right now. Let's see. For some reason, I don't have January, but in February we did 6 new single-family dwellings and 94 total permits. However, we had a lot of them pending with a short month that we have 10 that went out on the 1st of this month, which probably would have gone in February if it was not a 28-day month. So,
Tracking.
so, I'm sorry. In January, we had 11 new single-family dwellings and 75 permits total.
Thank you so much.
Thank you. Anything else? Thank you.
So now we come to everyone's favorite part. What are the next steps from here? And I believe that you said that, because at last meeting, we set this meeting, but we didn't set that we were going to meet like every Wednesday. So is that what the pleasure of the board is, to get this process knocked out, is to meet every Wednesday, or what, or when do you want to meet again for the next budget work session?
When will staff have information for us?
So I didn't know if you wanted additional agencies, outside agencies to come. I could, I got the ones that came tonight. Of course, we had narrowed it down, asking for requests for particular agencies. I got 3 individuals who responded the exact same ones, and then I contacted a few others later, and one of them was able to come tonight, but I have one who's already would like to come to the next meeting. And if there are any others that you would like to have come as well.
I like that we had the 3 that we had been funding coming to justify, and I would leave it to, honestly, I'd leave it to them if they want to come. If there's someone who's really wants to come, that will carry a lot more weight with me than just handing in a request and saying, what can you give us? So, I leave it up to them. I'm not going to beg them to come and present, but that will have an impact.
The agency that couldn't come tonight was the food bank. And I think that the food bank has been coming out to King George throughout COVID to help our citizens.
Mm-hmm. If they're available to come and present at the next one, I'm certainly amenable to having them.
And I had tentatively given them the date of next Wednesday.
That was one. Fredericksburg Regional Food Bank is one I would like to see come. Thank you.
Are there others that you would like to?
American Red Cross.
And that one, I need to actually call them because their email address keeps bouncing back. So I don't know if they've replaced staff.
Okay, I asked that specifically because I know anytime we have a house fire in the county, they support the families with relocation and, temporary shelter. And also when we did our warming shelter back in January because of the snowstorm, American Red Cross supported that too, in addition to DSS staff and Parks and Rec staff. Thank you.
If you could grab those 2, if they'd be willing to come out, and then like Mr. Granger said, I mean, any of them that want to come out and give a brief, it certainly, it would benefit them.
Okay, yes, because at the last meeting you said you wanted all of them to come, and as you can see tonight, we're still here and we had only 3 come. And then also for our next meeting on departments, we had 2 others that you had requested, economic development as well as the registrar, and both of them had prior commitments tonight and were not able to attend, so they will be attending the next meeting.
All right, I'm going to go back to my other question was, how much time do you guys need?
Well, the outside agencies, I can contact those tomorrow. The additional staff
They'll be ready.
So we can, and what we plan to do at the next meeting is to bring a preliminary expenditure, the big sheets that we bring. And of course, those preliminary expenditures have all of the positions that were presented to you tonight already in them. So keep that in mind and let us know, whether, at what point you want us to start taking some items out. And as far as revenue, we don't really have any, I mean, I've started playing with some of the numbers that aren't relying on other agencies, but time has been spent between, you know, trying to get the presentations and people lined up, as well as the other, this makes my third meeting this week. So preparing for those meetings as well. But I don't know that any preliminary revenue numbers are not going to be anywhere near accurate.
On the preliminary expenditures, Mr. Collins had asked that for a budget document, and maybe you could clarify, because I think that what I'm understanding, what the rest of the board gets is these preliminary expenditures in this format that I think Ms. Hahn is talking about at the next meeting. Is that something that is what you're wanting, or are you wanting something else? I need that clarification, because I don't want to not fulfill what you're looking for, and I'd like the board direction on this too.
I wasn't asking for the rest of the board. I was asking for myself. I was asking for a budget book similar to what I got for last year's budget in a binder where it has all the entire budget. That's simple.
You mean
I
what you
understand
got
that,
from the
but-
schools?
Excuse me?
No, what we gave you earlier in the year. That's what he's talking about, the summary of the work sessions that took place. Now, some of that won't.
Talking about each department budget, like you provided me. So it's probably about 20 pages maybe.
Yeah,
That's the big,
that was the summary of the work sessions that the
and it
board
was
did.
probably printed smaller for you. And that took more pages, but when we work in here so that everybody can have it, it prints out on a large sheet, and it's probably about 9 to 10 pages. And that's what we're planning to bring to the next meeting.
And there won't be any revenue in there though, of course, because
That's a separate sheet.
Right.
That's about the same thickness of paper.
Okay. So is the next meeting March 9th?
That's our proposal. It's up to y'all.
You guys, are you going to be ready with our great revenue, multicolored?
Not with
all
the
that stuff.
expenditure, preliminary expenditure.
Okay.
You'll have
multicolor.
2 additional departments that you'd consider, that you asked for.
at
And then you would
least
have
2.
these 2 other outside agencies potentially.
So Ms. Thompson was my person for the advisory committee.
We will notify her. I think we just got it late. I'm sorry that we didn't have a chance to get her here. We'll make sure she's here.
Wednesday, 5:30. Wednesday, the 9th, 5:30. Hopefully here, if the room is available.
Yes, and I'm guessing that you'll have.
My understanding is at 5 o'clock, there is a board of equalization meeting. So
and
that,
that's probably several.
however, if that changes, then we could do it here. Otherwise, we could do it at the fire station. So company 1 across from Food Line.
Okay. 5:30 at one of these 2 places.
We'll let you know.
Mr. Dines wants to hear. Okay,
That is.
that's it.
Anything else?
All right. Do we have a motion?
Move to adjourn until 5:30 PM. I'm sorry, till Wednesday, March 9th at 5:30 PM to be determined, either in the boardroom or at company 1.
We have a motion properly second. Any discussion? Seeing none, all in favor?
Aye.
Chair votes aye. We are adjourned.